Hey, good evening, everybody. It's 7 o'clock. Sego ani buju endio wacheya kwe kwe. As the mayor of the city of Kingston, I offer these words in the spirit of this gathering. Let us bring our good minds and hearts together as one to honor and celebrate these traditional lands as a gathering place of the original peoples and their ancestors who were entrusted to care for Mother Earth since immemorial. It is with deep humility that we acknowledge and offer our gratitude for their contributions to this community, having respect for all as we share this space now and walk side by side into the future. So we were just meeting in council as a committee of the whole closed meeting. We discussed several items, the Ontario Nurses Association negotiated settlement. We discussed Committee of Adjustment Appeals, and also discussed the local planning appeal tribunal appeal for 223 Princess Street. So I will ask for a motion to waive procedural rules and have the clerk report.
Moved by Councillor Hutchison, seconded by Councillor McLaren, that Council rise from Committee of the Whole closed meeting, that the rules of bylaw number 2021-41 be waived and the City Clerk report.
All those in favor? Opposed? And that's carried.
Moved by Councillor Neal, seconded by Councillor Chappelle, that Council ratify the collective agreement and authorize the Mayor and City Clerk to execute the agreement between the Corporation of the City of Kingston and the Ontario Nurses Association for the period of April 1, 2020 to March 31, 2023.
All those in favor? Opposed? And that's carried.
Moved by Councillor Osterhoff, seconded by Councillor McLaren, that Council direct staff to report back on April 6, 2021 with a high-level summary of the settlement that has been agreed to in principle by the applicant and appellants in relation to the local planning appeal tribunal appeal for 223 Princess Street, subject to the city's acceptance of same and a recommendation regarding the city's participation in the appeal.
All those in favor? Opposed? And that's carried. Okay, moving on to the addeds, we have some communications and the addition of a bylaw on the addeds. Can I have a mover and a seconder for the addeds, please? Moved by Deputy Mayor Holland, seconded by Councillor Stanek. All those in favor? Opposed? And that's carried. Are there any disclosures of potential pecuniary interest? Deputy Mayor Holland.
Thank you, Your Worship. I, Mary Rita Holland of the Council of the Corporation of the City of Kingston, declare my pecuniary interest in the matter of Clause 1, Report number 36 from the Arts, Recreation, Policies Committee, Local Food Strategy and Amendments to the Kingston Public Market Bylaw, as I am a vendor for the 2021 Spring-Summer season at the Memorial Centre Farmers Market.
Okay, thank you. Are there any other disclosures of potential pecuniary interest? Okay, seeing none, then we will move on in our agenda. We have no presentations this evening, but we do have 3 delegations. And just a reminder to each of our delegations that you have 5 minutes, and then we will open up to questions from council. So our first delegation is Tim Pater from Downtown Kingston BIA board member, who will appear before council to speak to Clause 1 of Report number 36 received from the Arts, Recreation, and Community Policies Committee with respect to local food strategy and amendments to the Kingston Public Market Bylaw. Mr. Pater, welcome, and you have the floor.
Thank you, Your Worship. Good evening, councillors. I'm in here in delegation on behalf of the Downtown Kingston BIA to offer our support for the proposed changes to the public market bylaws. We've seen a decrease in the number of local producers in our market over the past several years. The current attendance requirements are not realistic for many busy farmers. Providing more flexibility will make the market more viable and help to attract more producers. The downtown community believes in the local food movement because it adds to both the social and economic life of downtown. More people are interested in purchasing local food. More restaurants are using local food as components of their menus, and Kingston is known for its culinary offerings. Local food will play a critical role in rejuvenating our tourism sector once COVID restrictions are lifted. Buying local is one of the market trends forecasted to continue well beyond the pandemic. The BIA was heavily involved in the original Local Foods, Local Chefs program, which resulted in the Project for Public Spaces document on improvements to the market that was submitted to City Council in 2012. The current proposed changes are supported by this study. The possible addition of preparation and food sampling at the market would be welcomed. It would allow us to further augment our local foods chef demos that have been running since 2010 and could lead to even more year-round events. The road to recovery for downtown will be a long one, and the new proposed amendments to the bylaw will create an opportunity to grow food tourism and to develop new product that will attract consumers to our downtown. We see opportunities for more programming and activities through the winter season, with the possibility of night, holiday, and makers markets during what is a challenging time of the year. As a local restaurateur, it has been disheartening to witness the decline of the market, especially when it had been so vibrant in the past. With many more producers attending, chefs were able to buy a much larger variety of local products for their menus and in turn help to support the local economy. It is important to support our local farming community by providing enhanced opportunities to sell their products in our public and other markets, which will increase the viability of their operations and in turn add to local food security. The BIA has been advocating for changes like the ones being proposed for many years, and we are happy to see them before Council tonight. We hope that you can also support the amendments to the Kingston Public Market Bylaw. Mayor Patterson, this concludes my comments.
Okay, thank you very much. Are there any questions from Council? Okay, seeing none. Thank you very much, Mr. Cater. With that, we will move to our second delegation this evening. Megan Knott, Executive Director of Tourism Kingston, and Krista Leclerc, Executive Director of Kingston Accommodation Partners, will appear for Council also to speak to Clause 1 with report number 36 with respect to local food strategy and amendments to Kingston Public Market Bylaw. Ms. Knott and Ms. Leclerc, you have the floor.
Thank you, Mayor Patterson and members of Council. Thank you for the slides. So similar and mirroring exactly what Mr. Pater just presented to you, Tourism Kingston alongside Kingston Accommodation Partners has really sort of the same support and supporting pieces and documentation as presented by our DBIA partners. Next slide, please. So obviously City Council is very well versed by this time on the Kingston Integrated Destination Strategy. I don't need to spend time on it, but just know that through the IDS and the IDS research and findings that we know that the Kingston Public Market specifically was one of the pieces that was called out in this strategy, specifically to call on improvements as it relates to the culinary asset that public market presents to us. Next slide, please. We also did a partnership with the DBIA and other local partners such as RTO9 in regards to the Kingston culinary strategy. This document, again, as presented to Council in the past, just informs a roadmap for how we support culinary in the city. And again, this specific strategy outlines how we can bring further improvements to the Kingston public market. And most of these improvements are captured in the development of what you see in front of you tonight at Council about the proposed bylaw changes. Next slide, please. The alignment between these two strategies, so that of the IDS and the culinary strategy, really calls on four things. It calls on supporting and promoting local foods. It calls on prioritizing local farmers as they present unique findings and offerings to visitors and residents alike. It also supports the farm to table narrative, which we venture to tell and to ensure the uniqueness of our farmers that only you can find in Kingston. And of course, it calls on supporting agritourism experiences. Next slide, please. And a fresh look. I'm going to pass this over to Krista.
Great. Thank you so much, Megan. And thank you again, Mayor Patterson and members of council for having us here today. I just want to reiterate again a couple of the things that Mr. Pater had mentioned as well, but we think that the proposed changes create a fresh new look for the market, providing opportunities for creative programming that includes food experiences like food preparation, sampling, chef demonstrations, and things of that nature. As mentioned before, possibility of a night market, potentially looking at holiday markets, future year-round indoor market, on the horizon. That would be fantastic. Again, looking at opportunities to have a year-round, always-on campaign focusing and showcasing the wonderful culinary opportunities that we have here in Kingston. And I think, just to build on that from the accommodations perspective, things of this in supporting extending stays, building overnights, bringing more people into the city, having them stay longer, spend more. Again, those are pieces that help keep our MAT strong, the municipal accommodation tax, looking at recovery for sectors that are really struggling. So these are all fantastic things that work together hand in hand in building our tourism economy and helping businesses get back on their feet. So thank you very much for your time, and we welcome any questions.
Okay, thank you. Are there any questions from council? Okay, seeing none, thank you both very much. With that, we'll move to our third delegation this evening. Ayla Fenton, Urban Agriculture Organizer from Loving Spoonful, will appear before council again to speak to Clause 1 of Report number 36 with respect to the local food strategy and amendments to the Kingston Public Market bylaw. Ms. Fenton, you have the floor.
Hi, everyone. Thank you. So like Mayor Patterson said, I work as the Urban Agriculture Organizer at Loving Spoonful, but I am also a farmer and a board member of the Memorial Center Farmers Market. And so I'm here to represent both of those organizations. The proposed changes to the market bylaw, we think, are crucial first steps towards creating a market that actually supports local farmers. As you may know, the Memorial Center Farmers Market was started back in 2012 by a group of local farmers, many of whom were actually vendors at the Kingston Public Market at the time. And that group felt the need to leave and to start a producers only market precisely because the existing bylaw and management of the public market disadvantaged them. And they felt that the city and the market were not prioritizing their needs. One crucial component of all successful farmers markets that I'm aware of, including the Memorial Center, is self-governance by the farmers themselves. So we strongly support the recommendation to move the public market towards a self-governance model that prioritizes farmers. And of course, the city needs to support all farmers markets within the city, not just the Kingston Public Market. So we are also grateful for the recommendation that the city waive fees for the other markets, including the Memorial Center. We are one of only a handful of farmers markets in all of Ontario that actually pays rent to the city, because most cities recognize farmers markets as a valuable public good and offer the space for free. So in past years, we've paid between $6,000 and $8,000 rent a year to the city, which of course is a drop in the bucket for the municipal budget, but is a significant portion of the operating budget for the market that could be better invested. So we are also very excited that this report includes mention of an indoor year-round market space. The Memorial Center currently operates the only year-round market in the region, and we are restricted to using the unheated Memorial Center barns, which of course poses significant challenges for vendors and customers and adversely affects sales when the weather is poor. So Loving Spoonful is also very encouraged to see the beginnings of a local food strategy framework laid out in this report. Of course, all of the research related to food systems and climate change, food security, social justice, and rural economic health all point to the need to rebuild food systems that are localized, that are environmentally regenerative, and that are rooted in principles of equity and justice. And so on this note, Loving Spoonful strongly endorses the recommendation to improve access to city-owned lands for food production. We have already been in conversation with city staff about expanding the community gardens network and even co-creating an urban community farm that could train aspiring new farmers, provide farm business incubation services, and provide low-cost local fruits and vegetables to food security programming in the city. So land access and other supports for new farmers needs to be a key pillar of this local food strategy moving forward. And we would very much like to see council provide staff with a mandate to prioritize this work, and of course to allocate sufficient funding to resource it. Part of my job at Loving Spoonful is coordinating the community gardens network, and I can certainly tell you that the demand there is far outweighing the supply. There are probably close to 400 people on wait list for community garden plots throughout the city right now. And unfortunately, the process for starting a new garden is quite onerous, and the startup grant of $750 that the city currently offers for new gardens is completely inadequate for covering the costs of construction of raised beds that the policy requires. So the result is that we currently only have community gardens in higher income neighborhoods where residents have the volunteer time, the skills, and the financial resources to fund the garden construction themselves and navigate that process. So if the city would like to actually see some equity in terms of access to land for food production, increased financial resources for coordination and garden installation costs will need to be budgeted for. I would really encourage council and staff to check out the City of Victoria's model. They have a program called Growing in the City, and they are absolutely top of class amongst Canadian cities that are encouraging subsistence and commercial urban food production. And as a city of a similar size, I think that there's a lot of inspiration that can be taken there. We believe that Kingston holds absolutely massive potential for becoming a food systems leader if our municipal government is willing to take this work on. And our city is home to some really amazing food organizations. And so we hope that the council will approve these recommendations, and that city staff can continue to work with all of these grassroots organizations to further develop the local food strategy.
30 seconds. Oh, that's great. Good job. Thank you. Okay, are there any questions from council? Councilor Jordan.
Thank you, and through you, Mr. Mayor. Thanks for your informative presentation. I think we learned a lot and beyond the recommendation in front of us today. So I know there is a lot of support for local food in our community, and I'm really pleased to support what is in front of us tonight. I do have a very specific question, and that is, well, I think it's in clause 7.3, and it's the time. From time to time, the city requires the marker, like perhaps for special events like a film, for example. And I know there's been frustrations in the past on how much notice vendors have received. And the report says that there will be a 4-week notice. Is that enough time, do you think, for vendors to go and find an alternative place to market their wares?
Short answer is no. 4 weeks is certainly better than 1 week, which I think is what it was previously. The more notice, the better, of course. But what I would like to see, and what I know a lot of the vendors that I have spoken to would like to see, is that there are no Saturday markets canceled during the main growing season from May through October. For many of the farmer vendors, this is their sole source of income. And canceling a Saturday market during the growing season, there's no other outlet for that food if that's what they're depending on for distributing and selling their goods. So that would be, I think, what a lot of the vendors would tell you, is that they don't think it's acceptable to ever cancel the Saturday market.
Where to have to happen because of a film and the competing needs that are also important for our city. Do you think 4 weeks is enough?
No, like I said, I don't think it's enough. I think the ideal would be at least like 6 to 8 weeks. But 4 weeks is certainly better than the current situation.
Okay. But what is the current situation?
I believe the current bylaw allows it's either 1 or 2 weeks.
Okay, thank you. Next is Councillor Oosterhoff.
Thank you, Mayor Patterson, and thank you, Ayla, for your presentation. And I think it really resonates with council affirmatively. I think that we really want to encourage you to move forward with what you're doing. I probably should know a little bit more, but I have always been a supporter of community gardens and would love to see a considerable expansion. And I guess my question is specifically, are they working on a financial model that could be presented and similar to Victoria or something size specific for Kingston? Because I think you're really, really right on with what you've spoken there and the potential that we have here, and that we could have gardens available in all the areas of Kingston that need it, and that we could simplify our streamline processes. I'd be willing to to pull that with you, and support you in that in whatever way. This is a passion for me to see our food chains have the support, and so I guess I want to ask you that: are you working behind the scenes and really clarifying what needs to change locally, like we are doing right now? And I applaud City Council and the staff for supporting this and driving it forward with you guys. But what are you working behind the scenes on a new financial model that we can study?
Yeah, so I've been doing quite a bit of research into other jurisdictions and what models exist in other cities in Canada and the United States. Victoria is a really great example, and just to kind of highlight the difference, in Kingston currently there's a pot of about $5,000 per year that's allocated to community garden grants.
Okay.
And that's the $750 startup grant that I mentioned for the first year, and then $500 per year in subsequent years for maintenance. And to compare that to the city of Victoria, which actually has a smaller population than the city of Kingston, they allocate upwards of $50,000 to a grants process, so that they're providing up to $10,000 for garden startup costs, which is a more appropriate number that actually covers the cost of construction of a large, a medium-sized allotment garden. And they provide funding for grants to help with community garden coordination. So that's one example, but yes, I am working on putting together some proposals around what best practices would be, and what sorts of financial investments from the city would be required to reach those types of goals.
Okay, I would applaud that. And if you, I'm just kind of gonna say, if you email me, so I have a bunch of ideas for you.
I certainly will.
Thank you very much. Are there any other questions from council? Any questions? Okay, seeing none, thank you very much, Ms. Fenton. So with that, we have no further delegations, so we will now move to briefings. We have one briefing on our agenda. Dr. Kieran Moore, Medical Officer of Health for KFLNA Public Health, will brief council on COVID-19 and vaccinations in the KFLNA area. Dr. Moore, welcome. As always, you have the floor, so please take it away, and then if you're okay to entertain some questions from us afterwards, that would be great. Thank you.
Thank you, Mayor Patterson, and through you to council and the community. Yeah, I have some updates I can give you just on our current status. What I should first do is just thank the community. I think our community is doing relatively well. We've had tremendous support to limit the spread of COVID-19 in our community, and tremendous adherence to best practices, and it's certainly deeply appreciated from everyone here at KFLA Public Health. I also have to thank, through you, Mayor Patterson and Council, all your staff that have helped us. We've used the Memorial Center, if you will recall, as an assessment and testing site. Then we moved to Leon's, and now we're using the Invista Center. And the partnership with the City of Kingston has, to be honest, in my opinion, has never been stronger. And we very much appreciate all the support that you've given us. And I really do think the communities come together, whether it's the police, the bylaws, paramedic services through Frontenac Paramedics, our addictions mental health services, our hospital, our primary care, our pharmacists. We're all coming together, and I do see hope at the end of this, although I will say up front that I think April will be a difficult month for us, given the spread of the virus across Ontario. So just today in Ontario, we've had 1,546 cases. The percentage of tests that are positive is 4.7%. 868 individuals in hospital today. with 324 of whom are in the intensive care unit. So those numbers are starting to go back up, and we're talking about a third wave in Ontario, and there are variants of concern that are taking over as the main vector of illness. And so we have to be very, very vigilant over the coming months, but in particular, April. For our region, we have 92 active cases today. Our rate of illness is 37.5 cases per 100,000. That's gone up very rapidly, but I do think we have control. Over the last several days, the total number of cases per day is trending in the right direction, and it's coming down every day. So I have to thank the community for embracing prevention and keeping your social circles small, and our case and contact managers. And I have to say we have a significant group of volunteers helping us with contact management, and that's really helping us stay on top of this. So we do have more cases. The good news as well is that no one is in hospital at this time, and we have had no significant impact on intensive care services, emergency medical services. And through a collaboration with the City of Kingston, we've been able to have, I think, one of the quietest, sadly, St. Patrick's Week celebrations ever, and have to thank the community for that. We haven't had a super spreading event, which was my biggest concern, that we'd attract young people to Kingston to celebrate, and our streets on St. Patrick's Day were empty, relatively. And to me, that's a win, and we had not had a super spreading event as a result. Also, on a very positive note, we have delivered through multiple partners, Kingston Health Sciences Center, Kingston Community Health Center, our primary care partners, and our pharmacy partners, 43,000 doses of vaccine in our region. 58% of those over 80 years of age have received at least their first dose, which is remarkable coverage for our region. 64% of those aged 60 to 64 have received their first doses as well. And as a result, the population coverage of those over 16 years of age in our region is 18%. The average for Ontario is 10%. So we have a plan to get 80% coverage of over 80s, over 70s, over 60s. That's a number that we're trying to achieve to get good population coverage, so that in the fall we can start to get back to normal. And we've had multiple sites where anyone can get immunized, and we're partnering now with primary care. We expect around 40,000 doses of vaccine till the end of April, and all of those will rapidly go into arms to best protect those that are vulnerable in our community. And as you may recall, we have a vaccination strategy for now anyone over 75 can go online at ontario.ca and book an appointment, or call the 1888 number to get an appointment, or our local pharmacies. 47 different pharmacies across KFLA are participating, and you can receive a vaccine either through a booking system online or a phone call. So I'm very happy with the rollout to date and the partnerships that are existing. But given that a significant proportion of our cases now have that variant of concern, we all have to keep our social circles small. We have to remain vigilant for April, as we want to get those 40,000 plus doses into the arms to best protect vulnerable people in our community. I think we're making good progress, but April really is a month where I think we have to hunker down, limit our social contacts, and as a result, limit the spread of this virus. If you just look to Eastern Ontario Health Unit, they're in the red. Ottawa's in the red. Their rates are over 50 per 100,000, and they've all had a significant impact on their hospital sectors. And Leeds Grenville Lanark has a rate of illness that's significant as well. I don't want us to get there. I want us to embrace prevention. And the way we can minimize the spread of this virus is in your social circles, keeping them small, limited, 5 or less outdoors, 5 or less indoors, and that's how we can limit the spread of this virus. I'm happy to stop there, Mayor Patterson, and take any questions from council.
Okay, thank you. Thank you very much, Dr. Moore. Questions. First on my list is Councillor Bowe.
Thank you, Your Worship, and through you, Dr. Moore, once again, thank you for everything that you're doing for the community. I guess I'm going to ask a question that kind of almost seems like an elephant in the room, and I'm sure I'm not the only one experiencing this. And anytime people are asking me about the current increase in cases, it seems that there's a direct association in the questioning with Queen's University and perhaps student parties or anything that's going on there. So I'm just curious if you could address that and just kind of clarify where these cases are coming from, because right now there's a narrative that it seems to be persons in the public through reading the media or any other type of information seem to be associating the massive increase in cases in Kingston recently with Queen's University. Is that a fair assessment, or are those cases even related to some of those get-togethers? I just want the facts out there, please.
Oh, so at least 2/3 of our cases are in younger people in our community. We had an outbreak on campus that I think through great partnerships, Queen's University is under control. That was in a residence, Watts Hall in particular, and that activity on campus at Queen's through great partnership, early identification of cases, good testing strategies, good isolation is under control. I do think before our Section 22 order came in play, the week of St. Patrick's Day, there were social events that were occurring. That was allowed under green, so groups of 10 or more were allowed, were up to 10 at an indoor setting. And I do believe that that's where the virus started to spread. It probably started after reading week, where people naturally would have gone home. We didn't advise that, but that's a tendency if you want to see your parents, etc., or for essential purposes. And the virus came back and started slowly spreading in that environment, but then it can reach a sudden momentum very quickly. I know some people are upset. We do have significant off-campus activity of the virus. These individuals are members of our community. Queen's has been with us. I guess the charter was signed in 1841, and we've had students in Kingston since that time. I can understand their anger, but the virus is where we should direct our anger. It's very nasty. It spreads easily. Even if you're in small social groups, it can spread, and it can spread asymptomatically. I don't like blaming any organization or person. I blame the virus for being here and being nasty and aggressive and spreading. I do think since we put the Section 22 order, we haven't seen and asked our community to embrace smaller social circles. We haven't seen any significant events that have been super spreading events since that time.
Thank you for that wholesome answer. Just to quickly tag on to that, I know when you mentioned the smaller social circles, I believe in the news it reported that people can potentially travel to other cities to receive vaccines. I know there's a little bit of consternation about that. Do you have any concerns about that? Or is that just a way, if somebody comes here from Ottawa to Kingston, is that just a way to get everybody vaccinated quicker? Because I know the vaccines have an expiry date. They're only been viable for so long. So could you just quickly comment on that? And then I have one quick follow-up after that.
Yeah, so that's a good question. We asked the Minister of Health and the Chief Medical Officer of Health, and just like you can seek healthcare, you can go to any emergency department if necessary across the province. There's no limitation of where you can get the vaccine in this province at this time. And initially, this vaccine, we had 47 participating pharmacies, each got around 500 doses for ages 60 to 64. Well, we only have 14,000 individuals in that age group. Because of the extra supply, people from Leeds Grand Lanark, Hastings, Prince Edward, and Ottawa did avail themselves of the vaccine. We would have never been able to use all of the vaccine for that age group. And yes, it had to be used because all vaccines have an expiry date. We have been a source of immunizing over 3,000 individuals for AstraZeneca outside of our region over the last week. I'm not happy about travel, but this is a resource for all Ontarians. If anyone was traveling, they get screened at the pharmacy and make sure you don't have a fever, a cough, any symptoms of COVID-19, you're wearing a mask, you're having the appropriate physical distancing. I got my shot of AstraZeneca today, and I was very impressed by the protocols the pharmacies had in play. So I don't think that was a threat or risk to our community. The vaccines aren't ours, they're Ontario's, and they're for all Ontarians. We just had the advantage of starting the program early as a pilot. I'm very confident that Ottawa, Leeds, Grenville, Hastings will now have their pharmacies and have AstraZeneca available within them very, very soon.
Okay, thank you for that. Yeah, it sounds like there's protocols in place and that the amount of travel will decrease over time.
It will.
Thank you for that. Just one further question on there was a video that came out basically speaking to the new gathering limits. It's 5 indoors, I believe, and 5 outdoors. So, and even in the video, it did say household members only. So I have 5 children and then my wife and I, so there's 7 of us. So how do we decide which 2 of us don't get to stay in the house anymore?
Well, great question.
I say that in jest, but if you could actually just clarify, because I've actually had questions from some larger families about how they're to manage that.
Any household, absolutely, you stay in your household. It's just that we don't want you to have 5 more people over to your household, and we'll try to get some more risk communication out as we head into Easter. I don't like putting public health measures in play. I don't like restricting freedoms. But I do think this is essential. I'd like to keep us in yellow. I don't want any further impact on our businesses. And one compromise is that as a community, we agree we'll keep our social circles small and let our schools, our businesses, our restaurants continue to be open and hopefully get back some semblance of income into their pockets and maintain our schools open. But let's keep our social circle as small as possible. So keep to your family. Don't invite 4 more people or 5 more people over. If your household's 10, your household's 10. But just don't expand it beyond.
Sounds good. Appreciate it. Thanks again for everything that you're doing. Cheers.
Well, thank you. Thanks for the questions.
Thank you. Next on my list is Councillor Osterhoff.
Yeah, thank you, Dr. Moore, and thank you for the incredible work you and your team do on a daily basis. And I sort of was thinking about Councillor Boehm's family there. We're all realizing the size, but there are other, actually, it's very real for other families. And so I really appreciated your answer. I mean, I thought it was true. We would all take his newborn. It was so beautiful, but help him out.
Congratulations.
But seriously, I know that some families are under stress, and so maybe there's a way that we can communicate that. Some families, I just heard from one in my district, and so maybe other councillors have that, where they actually need family assistance for special needs children. And how can we offer, how can you give them guidelines, and what can we, how can we look to you to allow respite for these homes that are under particularly difficult medical and family crisis?
Well, we absolutely want to support those families, and we've had good feedback on risk communication for those eventualities. So over Easter, we don't want solo individuals stranded, and so we're going to make suggestions that you can invite that solo person, whether they're elderly, to come join your family, but don't invite multiple individuals to come into your family because that is where we have a high risk event. And certainly if they're medically necessary or socially necessary, please create that small social circle that will be supportive, that'll meet the rules. The concept is really what we're trying to get everyone in the community to embrace, is mainly keeping your social circle as small as possible so we don't get transmission over the next several weeks, because we are at a high risk point.
Thank you very much. So if there were special concerns, is there a contact person in your office that they can clarify how they would handle their situation? I guess there is.
Yes, they can phone the health unit. We have a phone line for clarification on the section orders and or making any compromise solution that would maintain their health.
Thank you very much.
I like the Toronto Maple Leaf shirt, by the way. Thank you.
And next is Councillor Chappelle.
Yes, thank you, Your Worship. Dr. Moore, I appreciate everything you're doing for the residents and the team of healthcare professionals you have working alongside of you to help keep our community safe. On that line of thought of keeping our community safe, you had mentioned the university, and certainly Principal Dean has come to council and preached about how he's proud to have the smartest and brightest Canadian students in Canada attending Queen's University. And with that, a number of students were reported to have been charged for parties $10,000 fines as a means to quell this. And yet the code of conduct does not seem to be enforced with Queen's campus. They don't suspend a student, kick them out, and take their money. Do you think the $10,000 fine should be upheld as a demonstration to, these smart students supposedly knowing the law?
I do think the law has to be enforced. This is any of our orders have been, whether it's the Reopening of Ontario Act or the Section 22 orders, I think have been well communicated to the community. And if they are flagrantly disrespected, then the law has to be abided by. I don't have real insights into Queen's process. I do believe they have a student code of conduct. And that they are prepared, if someone's found guilty, to use that student code of conduct. But all that, I have been told that it takes a significant amount of time for the processing, and some of these tickets are court appearances. You must go to court and have the due process of law. But I think we should pay attention to this and monitor Queen's response.
Okay, thank you. Next is Councillor McLaren.
Thank you. This is a question from a constituent who was asking about reports in the United States, how they are wasting some of the vaccines because people aren't taking them. And you mentioned that we have extras and there are people coming from other communities coming here. Is there any danger that we might have that much vaccine hesitancy where we might actually have to throw any of them away?
Okay, well, good question. I said extra because we were only allowed to provide AstraZeneca in pharmacies for the ages of 60 to 64. And we were given 23,000 doses for roughly, if we had complete 100% adherence for 14,000 doses. Now that it's been expanded from 60 and older, I think our pharmacies are rapidly running out of vaccine, and they'll be waiting for their new supply in April. I also don't want anyone to think any dose is being wasted in KFL&A. We empty, our goal is to empty the fridges, as the General says, General Hillier, every Monday. We try to get every dose that's been delivered the week before into arms, and I hold my team accountable, and we've been very successful in ensuring that every dose is provided, and we have no wastage, we have no expiry dates occurring on any of our vaccine, and if that was any of the communication that got across, I'm very sorry. Needles in arms is our motto, no wastage, and every dose is used. And I do believe now that the age groups have been expanded, that all of the AstraZeneca will be in arms before the expiry dates of any of the vaccine.
Thank you. And a second question from a constituent. The European Union, some countries have banned AstraZeneca, and I suspect it might be geopolitical. They might be upset with the British because of Brexit or something like that. Have you, in your studies, seen any legitimate concerns that some of these countries that have banned it? Have you seen anything that might suggest that we should use another one, or are all vaccines essentially the same?
Well, number one, there's very good safety monitoring of all vaccines in Canada and nationally and internationally. So if any signal of harm or adverse events is identified, it is investigated. So I'm happy that an investigation has occurred in Europe. I don't think the conclusion has been made yet. There is a very rare event that can occur called, it's the sticky parts of your blood called platelets, where the platelets can get very low. And then you can get some blood clumping. There has been an association with the AstraZeneca vaccine at around 1 in a million doses in very particular events. It still needs to be investigated thoroughly, but it is around 1 in a million doses that event has been occurring. That manufacturer does not provide the doses for Canada, nor have any of the lots that have been associated with this arrived in Canada. So I do have confidence in our supply. I have confidence that if this is a truly causative event associated with the vaccine, that it is exceptionally rare, and the risk of the disease of COVID-19 far outweighs the risk of a 1 in a million potential side effect in a small number of individuals. That's why I was confident going into the pharmacy today, having booked my vaccine. I'm age eligible and gotten AstraZeneca. I have complete confidence in all of the vaccines. And as you're seeing and reading, once they're in the real world, the effectiveness of all of the vaccines at preventing hospitalization and preventing death is very, very powerful in the high 80s, which is just remarkable. Hence the reason, if you're offered a vaccine by age eligibility or by medical eligibility, please, no matter what the vaccine is, they're all very effective at preventing hospitalization and death.
Thank you. And if I may ask one more question, there's I've been hearing from some who are vaccine hesitant that they don't want to get it because they feel that if any adverse effects are developed, they won't be able to sue the manufacturer for damages. Is that true in Canada? And if it is there anything that can be done about it?
The good news is that our Board of Health had lobbied, and thank you for being on our board, Councillor McLaren, for a mandatory compensation system. We had sent a letter to the Prime Minister and a few months ago that they have embraced a mandatory compensation system if anyone has an adverse event following immunization that is medically validated, and you would, it's like an insurance system, you would receive compensation for any adverse event. Suing a major pharmaceutical was a major obstacle, and hence the reason your local public health agency lobbied for this mandatory compensation system. The federal government subsequently hasn't given us details, but they have agreed that that will be in place in Canada, and I would assume it goes retrospectively. It goes and would compensate anyone that's received the vaccines. So thanks for that question.
Thank you. Deputy Mayor Holland.
Thank you, Your Worship. And thank you, Dr. Moore, for the fantastic work, our expert communicator, which is so important, and everyone really values your leadership. I have two questions. The first one is related to the pharmacy distribution of the vaccine versus the online booking system for the province. So there's two different age categories for eligibility there. Over 60 if you're going to a pharmacy, or at 75 and older can book through the portal, the Ontario portal. Is there a difference in terms of supply? Like, is there a preferred route, would you suggest?
Well, good question. And you're right, it's very dynamic, and I could understand that being confusing off the start. The government wasn't expecting to get this extra doses of AstraZeneca and had to rapidly put it in play. And they made a decision at the government level to use the pharmacy system. And initially, the National Advisory Committee on Immunization said you could only give it to 60 to 64 years of age. So that's the rule that they followed. Now it's 60 and over, now that we have better evidence that it's very protective against admission to hospital and death. So the age group then was expanded. So I'm happy they're following the evidence and they're responding and making the vaccine more available. But I could understand it being confusing. The online booking system is for mass immunization clinics. And so we have ours at the Invista Arena for KFL&A. And the product there is mainly going to be the Pfizer vaccine, because it's you need really close supervision of it, because it's the -80 vaccine that needs a diluent and then needs to be drawn up, and we have to get 6 doses after every 5-dose vial. So we've made a decision to keep that to mass immunization clinics. Locally, we've also made a decision, once we get Moderna, which is an mRNA vaccine, and further AstraZeneca, that AstraZeneca will continue to be distributed in our pharmacies. If there's extra, it'll go to primary care. And going forward, Moderna in KFL&A will be delivered through primary care partners. Hope that adds a little clarity. And thanks for the tweet on St. Patrick's Day. That was very kind. I saw
I
that.
hope you somehow had a good day. Thank you. Yeah, that definitely clarifies. And of course, given the pilots and how dynamic the situation is, I think members of the public understand that, but it's just good to get a little bit extra clarity there. The other question is regarding the introduction of asymptomatic testing for students. And there was a notice today from Limestone District School Board on this. I think for most parents, when they heard that this idea was coming forward, they assumed that it would be offered at the school, but it's not. It will be offered at the assessment center. And so I'm just wondering it's only for students who are asymptomatic. It would therefore be a parent's discretion to whether or not to take a student out of school and take them to a clinic to get tested. And I'm just wondering what your thoughts are on that, what the value is. Is this part of a sort of a bigger study to get that information, or is it for parents who are worried but feel they can't go to that assessment center because their children don't have symptoms?
Well, a great question, and I'll try to be brief. So this was an initiative of the Ministry of Education. It didn't have a lot of local public health input. And so the schools have been tasked with doing asymptomatic testing in a voluntary means, and it's rotating across the schools, and they've been given targets to offer a certain percentage of the population in their schools testing on an ongoing basis all the way through to May. It's not that relevant to our area, given the low incidence of illness. And we really haven't had many cases in the school setting. In Toronto or Ottawa, where the community rate's high, this is a means by which they can actually catch cases and then go back and find that if it's in the family, and then try to get a handle on the spread. So number one, it is voluntary. It's a Board of Education initiative with the Ministry of Health, and the designated assessment sites, whether it's in Napanee and or at Beach Grove, are the testing locations. You're right, I would have preferred it be more accessible and available on site, on location. If there is ever an outbreak, our teams, together typically with paramedics and or primary care, will go to the school and offer testing, especially the remote schools. And we've just done that at Land O'Lakes Public School in the Lennox and Addington area. If that gives any clarity. Did I answer enough?
Yeah, that's great. Thank you very much.
Okay.
Are there any other questions? Councillor Hutchison.
Thank you, Mr. Mayor. So I've been listening. Thank you so much for your presentation. We are covering, public health is covering 60 to 64-year-olds. And I think it was mentioned that above 75 were covered. What should the people aged between 65 and 74 be doing at this point? Because at one point you're saying, don't phone us. We don't have anything. Now we have some. Now we've used it up. I'm just trying to clarify what's happening.
Yeah, it's very early days. So thank you very much, Councillor Hutchinson. And it has been dynamic. Initially, the pharmacy dosing of AstraZeneca was for 60 to 64. On Monday, this Monday of this week, they expanded it to anyone over 60 years of age, although I don't think they have much supply left. At our mass clinics, it's 75 and above. And we have an adequate supply and good booking all the way through. So we have mass immunization clinics at the Invista Center, and we are partnering with other partners in the city of Napanee and with our Kingston Community Health Center and with the hospital partners to get and immunize other age groups or at-risk individuals. But for age-based criteria in the city of Kingston, it's mainly at the Invista Center at present. For the Pfizer product. Any additional Moderna product, we're partnering with our primary care partners, and they will run parallel clinics, but it'll be age-based as well, 75 and above.
Okay, being unmuted is sometimes a task. So between 65 and 74, they're just waiting to be told?
So that age group is eligible for vaccine through pharmacies now as of Monday.
Oh, as of Monday. Okay. I missed that.
And that's just dependent on the AstraZeneca supply. And I could understand you not able to keep up because it was just on Monday that they opened that age group up.
Great. And when would the vaccine not AstraZeneca be available?
So that is available. Pfizer's available in our clinics and Moderna. And that right now is age-based criteria, 75 years of age and older.
Okay, thank you.
Okay, next is Councillor Osanek.
Thank you, Your Worship, and thank you so much, Dr. Moore, for your update. We always learn so much from them. My question is about a newspaper article I read today about what they're doing in the city of Toronto, and they're doing door-to-door vaccines at their community housing corporation, as well as they're even using like their library staff to start phoning card holders that are in, the senior citizen age bracket to see, if they need help registering for the vaccines. So with the sites that we have in Kingston being mainly the Invista Center, and then I know we also have a site on Weller Avenue at the Community Health Center, do you see us also going to maybe a mobile clinic in sometime in the next couple of weeks to get more vaccinations out, or are we happy with just using the Invista Center?
Oh no, I'm sorry, I didn't fully describe we have a very robust delivery mechanism for vaccine. Just to let you know, we finished all long-term care facilities and have done all double doses for all patients in long-term care facilities. We are physically going to our retirement homes and we're done as of March 25th. All of our retirement homes, because we have set up mobile clinics and gone to all of them. We have gone to other vulnerable groups like the Integrated Care Hub and provided vaccination to individuals there as well as their workers because we've had incident cases in that environment. We have also partnered with Kingston Health Sciences Center, which runs a very robust clinic that started through their highest risk healthcare workers, their high risk healthcare workers, and is now moving on to the dialysis patients, to the immune suppressed, to the oncology clinics. And we continue to have our mobile clinics that go to hot spots or at-risk populations. So I don't want you to think it's just mobile spot or fixed places. We have also partnered with primary care and done drive-through vaccine clinics on Wolf Island just to learn how well we can do that, and are going to continue that type of model elsewhere. We've provided primary care partners in a quiet rollout with Moderna in their practices just to provide us with lessons learned. And Memorial Arena that kindly the City of Kingston is letting us use this week, we're piloting primary care partners using that clinic and using Moderna. We also have been able to move Moderna and are starting to go into homes to provide a vaccine to home care recipients with our paramedic partners and community paramedic partners. So, I could spend an hour telling you all the various projects we're doing. I think you should have confidence that we're trying to meet the most vulnerable. We're providing the essential workers, those that are most at risk, whether they're medically at risk and or through living in vulnerable settings. So the shelters we've been to already in the City of Kingston and immunize those living in shelter situations.
Okay, thanks for that insight, all that extra information.
Sorry.
And my last question is also from the newspaper that one of my constituents sent in. So I know that you sit on a special task force at Queen's Park, and so maybe you have some insight into this. In Quebec, for eat-in restaurants to try to, control the spread of COVID, they're just trying to have eat-in patrons, right, be from the region. Is there any talk at Queen's Park that maybe they might consider that for Ontario, or anything like that you've heard that we might go the same way as Quebec?
So that's more at a public health measures table, and I've heard again and again from the Premier that he's not interested in travel restrictions and or limiting travel within Ontario or even between provinces. I think that's been fairly clear. We did have a stay-at-home order that's gone. That was not actually enforced, to my knowledge, and travel restrictions are not a means that this government will pursue.
Okay, all right. Well, thanks so much.
Thank you. Are there any other questions from council? Okay. Seeing none, Dr. Moore, thank you very much again for your time, and thanks to you and your whole team for the great work. We appreciate it.
I have to say thanks for the partnership as well, Mayor Patterson, and to council. The City of Kingston has been a robust and very valued partner. We can't do it without you, and I'm happy to come back at any time.
Excellent. Thank you very much. Okay, so with that, we will move on in our agenda. Before I go any further, I'm going to recognize Councillor Stroud, who was going to raise a disclosure of potential pecuniary interest. So Councillor Stroud, go ahead.
Thank you, Your Worship. The Deputy Clerk sent me some wording, but it's regarding the declaration I meant that I made in camera. Let me just give me a moment to get at the wording here.
Okay, so Councillor Stroud, what I'm going to do is I'm just going to keep moving, and then you can just interject the point of order whenever you're ready with that declaration. Okay, so at this point, are there any petitions to present? Not seeing any. So we do have two motions of a motion of congratulations and a motion of condolence. First moved by Mayor Patterson, seconded by Deputy Mayor Holland, that the sincere congratulations of Kingston City Council be extended to Councillor Robert Kiley and his wife Meredith on the birth of their first child, Samuel Harris, born on March 6th, weighing 10 pounds, 7 ounces. Congratulations and best wishes to the Kiley family as they embark on this new exciting season of their lives. Then moved by Mayor Patterson, seconded by Deputy Mayor Holland, that the sincere condolences of Kingston City Council be extended to Brent Fowler, Director of Corporate Asset Management and Fleet, on the passing of his father, Gary Fowler, on March 10th, 2021. Gary was a retired firefighter for Kingston Fire and Rescue. Our thoughts are with Gary's family and friends at this difficult time. So we will call the vote, please. All those in favor? Opposed? And that's carried. Okay, we have no deferred motion, so we will move on to reports. First, we have report number 33 from the CAO.
Moved by Councillor Holland, seconded by Councillor Osterhoff, that report number 33 from the Chief Administrative Officer, consent, be received and adopted.
So they're just the clauses in the consent report. Would anyone like to deal with them separately? Okay, seeing no hands, then we will vote on them as a whole. So clause 1 is award of contract 2021 tree purchase, and clause 2, approval of brownfield initial study grant for 1121 Montreal Street. All those in favor? Opposed? And that's carried. Okay, on to report number 34 from the CAO.
Moved by Councillor Bowen, seconded by Councillor Chappelle, that report number 34 from the Chief Administrative Officer recommend be received and adopted clause by clause.
Okay, clause 1, renewal of the service level agreement between the City of Kingston and the Kingston Arts Council and council participation in the 2021 City of Kingston Arts Fund jury. So just note that I am looking for 2 volunteers, 1 councillor to participate in the operating grants jury, and 1 councillor to volunteer to participate in the project grants jury. We have volunteers. Councillor Chappelle, which jury would you prefer to volunteer for?
Through your worship, either one would I'll serve at the pleasure of our council.
Okay, thank you very much. Can I have another volunteer? Looking for 1 other councillor. Councillor Neal, thank you very much. Do you have a preference between the operating grants and the project grants, Councillor Neal?
I believe I did operating last time, so I think change of pace would be good. I'll do projects this time.
Very good. So just to confirm then, clause 1 will note Councillor Chappelle as a member of the operating grants jury and Councillor Neal as a member of the project grants jury. Okay, we will call the vote then on clause 1. All those in favor? Opposed? And that's carried. Clause 2, update on bylaw to prohibit open doors and windows when air conditioning operating. Councillor Neal.
Yes, a couple of questions. That was actually a two-part motion that passed almost unanimously, as I remember, in 2019. And this is the second time it's been deferred, which is somewhat frustrating. The other thing that I was curious about is the second part of this was requesting better enforcement of the anti-idling bylaw that already exists. I'd like to ask our CAO if indeed that portion, which takes no planning or work on part of the staff, will in fact be enforced more, because frankly, it hasn't been getting much enforcement in the past couple of summers in particular.
Okay, so CEO Hurdle.
Thank you, and through Mr. Mayor. So I don't know that I would have the answer to that question right now, Councillor Neal, but I'm happy to look into it. There may be other staff. I know there are a number of staff that have been involved with this initiative that are also on the call tonight that have been a lot more involved. They may have something to add, but I wouldn't be able to answer that question right now, Councillor Neal.
Okay. And
so Neil, I will just jump in though, just to note that the recommendation that is in front of us speaks only to the preparation of the bylaw for the open doors and windows.
I appreciate that, but the motion that passed was a two-part motion with the direction for greater enforcement.
No, I understand. I understand that. I think my point is that passing this does not preclude that further work, and it's not as though it would require some sort of reconsideration.
Yeah.
For the fact.
Yeah. So. I just want to say I don't believe I'll be voting in favor of this because this is a second time it's been deferred, and I really don't recognize or appreciate the fact that this was passed very early in 2019, almost unanimously, and we're deferring it yet again. So I won't be able to vote in favor of this.
Thank you. And next is Councillor McLaren.
Thank you. I also find this troubling. I think that we should be enforcing this pretty much right away. May I ask if I read the report correctly, is the biggest delay due to public consultation?
Commissioner Egg or Commissioner Hugenboss or Ms. Salter-Keene. We've got three hands all at the same time.
So. I'll start, Mr. Mayor, if I could, and maybe Ms. Salter-Keene can take over. So the staff did do public engagement and stakeholder engagement with businesses and the general public as per council direction on this motion. That work was done right before the pandemic hit. And then once the pandemic hit, several priorities and motions of council needed to be deferred. This was one of them that was as part of those deferrals. As the pandemic has continued and businesses are under a considerable amount of stress and changing guidelines and pivoting their businesses, especially downtown retail and restaurants, staff are recommending that it is indeed necessary to go back for more consultation on this because all that work was done before the pandemic. And that's the recommendation there. There were several concerns raised in the engagement about the effect it would have on business, on several businesses. And again, that was before the conditions of the pandemic presented themselves. So this is a recommendation from staff to defer so that more of that engagement can happen, and that information can be brought back to council and for early 2022.
Councilor McLaren.
Thank you. Okay, I totally disagree with that. So this is a special case where we have public consultation and we're asking individuals for their particular concerns on this. We are stuck in a framework known as the prisoner's dilemma. When an individual or a group of business looks at this and we ask them, how is this going to affect your business? Of course, they're going to say it's going to affect them negatively. The structure that we're dealing with is going to mean that if they look at their best interests from an individual perspective, they're going to get the worst outcome for themselves and for the community. And as an example of this is when they open their business, their doors, they increase their costs, okay? They think they're going to bring in other people, and it may work for the first person who does that. But when everybody does that, the benefit is lost, but the cost is still there. So this strikes me as one of those things that's as clear as arithmetic. If you get arithmetic, it's important to ask, like, what is 2 + 2? It's 4. But if you don't understand arithmetic, you're going to get the wrong answer, and we don't care about that opinion. Now, there is another motivation, which is even more troubling. If you had, as I saw in the report, there's a lot of people who felt that this was very bad for their business. If they are motivated because they can outlast the other by increasing costs to their competitor and then drive them out of business, that's the worst form of competition out there. And that may also be one of the motivations out there for saying this. I think this is really easy to do. Just do it. It's simple. I'm sure that the clerks could have the ability to write this in a few hours at the most. The public consultation that you're doing here is going the wrong way because of the particular structure that we're in. So I'm not going to support deferral on this. I think you should just write it and get it done. Thank you.
Thank you. Deputy Mayor, would you take the chair?
I take the chair and I recognize you.
Thank you. I would just ask council to take a moment to reflect on what our small businesses have been through over the last year. I would like council to think about the restaurant owners, the retail store owners, those in the downtown and in other parts of the community that have struggled with unprecedented challenges, where just trying to keep their business afloat, trying to avoid laying off their employees, trying to just make ends meet over the last year. And I would suggest to council that this would be the time where perhaps we should keep their interest, their livelihoods front and center. This is not the time to be able to add a burden to the small business community. It is a burden, and we can debate whether or not it's a burden where the costs outweigh the benefits. And to be honest, yes, as has been mentioned, this was passed, not unanimously, but it was passed back in 2019. That was a very different world. And so I am asking council to please support this. Let's defer this. Let's give our small businesses a chance to get back on their feet first before we start to throw these additional challenges at them. I think that's the least that we can do. And I really hope that council will follow that direction. Thank you.
Thank you. I return the chair.
Okay, next on my list is Councillor Hutchison.
Thank you, Mr. Mayor. I think we all agree, and we all voted for alleviation under pandemic conditions for small business throughout the city. And that is very much an important thing at this time, and economically important. The problem here is, what's the connection between closing doors to sort of not to proliferate, to prevent the wasting of air conditioning energy and being in business? That's not demonstrated here anywhere. And also, I think there's perhaps a misperception here. The question is that I would raise is this perception by the businesses that responded negatively grounded in reality That is walk-in traffic actually affected? It's an opinion survey. It's not a sociological study, okay? Or is it grounded in culturally received attitude or perception, rooted in a more energy prolific time that says this is the way to do things? And what we're trying to do is get people to change the way they do things. And if you look at the survey, you'll see that with the ask business, do you keep exterior doors and windows open while AC is operating? Well, under never, very rarely, or rarely, 34% say no, they don't do that. And I'm not sure what they mean by rarely, so it's hard to be more precise. Then we look at occasionally, and there could be a lot of occasions, or it could be very few occasions. That's unclear. Some people might have been thinking, well, I'll just be on the safe side, I'll keep the option open, right? And 27.6% said occasionally. You add all those more or less negative responses up, you get 62% of all businesses. Now the answer, it seems to me, is in the report. What did New York do? And we know why they've done this, because they got brownouts like going crazy 20 years ago. So what did they do? They exempted restaurants. We can exempt restaurants. And I would say most of your opposition is going to disappear because it's not really affecting 62%. So I have an amendment to the motion, which I believe the staff have, the city clerk and the assistant city clerk, they could just put it up there. I'm willing to amend it incidentally.
Okay, so we have a motion to amend. So let me just read it first. So it's moved by Councillor Hutchison that report number 34, clause 2 be amended by adding the word mandatory before the word bylaw, by adding the words and that staff be directed to proceed in the interim period as soon as possible with a voluntary form of the bylaw at the end of the recommendation, so that it reads as follows. The council directs staff to further defer the preparation of a mandatory bylaw to prohibit open doors and windows when air conditioning is in operation until Q2 2022, and that staff be directed to proceed in the interim period as soon as possible with a voluntary form of the bylaw. Okay. Okay, so first of all, is there a second? Seconded by Councillor Doherty. Okay, Councillor Hutchison, so the amendment is on the floor and you can speak to it.
Okay, so the concerns here are about, putting too much pressure on our small businesses. And that's fair enough. That's a fair enough concern. And so my amendment addresses that by saying, okay, let's get this process not deferred, but proceeding by differentiating between a bylaw that asks for a mandatory regime and allowing for a voluntary regime in the interim, still heading towards mandatory. Now, as I suggested, I didn't want to put this in there, that you could have an exemption for certain businesses, okay? So that you can get the very best out of what you're going to, what is at stake, and be able to accommodate as many businesses as possible and not cause too much pain. So, I think that underlying this, and I think where other councillors are coming from, is the climate change crisis did not go away. It's been with us the whole time for the last year or more. So, and so I think what a couple of councillors are getting at is, hey, we need to move along. But despite what's happened, and we can see the end, more or less, in X number of months, hopefully. And it's going to take time to prepare this. So I'm just looking to move the process along. And if it's voluntary, if somebody really objects, they won't be doing it, will they? But then we'll have to have a public discussion when Q2 2022 comes along. And so that's my argument for the amendment. Thank you.
Okay, is there anybody else that wishes to speak to the amendment? Next is Councillor Bowman.
Thank you, Your Worship, and through you. I understand what Councillor Hutchison's trying to do here. I'm just not sure that it's going to accomplish what we hope. So I guess a question to staff would be, I believe earlier it was stated that there was still more time needed to formulate the bylaw and to kind of do that public consultation. So is this amendment really going to change the timeline of how we get to the end goal here, which is basically, at the end of the day, we'd like businesses to cease keeping their doors open while their air conditioner is running. I think there's a couple different ways to get there. One is a bylaw. The other one is to incentivize them to close their doors and provide some benefit for those that do. But I guess my first question would be, is passing this voluntary bylaw, which kind of to me seems, I'm not sure if it actually is going to accomplish anything, is that going to affect the timeline of the creation of the actual bylaw, or will it still be going through the same motions, which means this is almost a redundant amendment in a sense?
So Councillor Bowman, I'm actually going to jump in here first, because the concern that I have, I've let it go, but as I've been thinking about it, I'm not sure that you can have the whole point of a bylaw is to make it mandatory.
And that was kind of where I was trying to go.
So while I appreciate what Councillor Hutchison is saying, I think that the idea is that if this passes, then it's mandatory, and if it doesn't pass, then it's voluntary. So Councillor Hutchison, I appreciate what you're trying to get at. I think I'm going to have to rule it out of order, because I don't think that a voluntary bylaw is something we can do. So I understand you're trying to push it along.
Well, you don't leave me much choice. It says in the report there are voluntary policies and bylaws.
So then I'm going to defer.
That are right there. They can be done.
So before I make a ruling, Councillor Hutchison, I'm going to go to staff on this. So can I get direction from staff? Is a voluntary bylaw something that could be implemented?
So thank you, Mr. Mayor. And sorry, the CAO may jump in here, and others who are better at enforcing bylaws than me and my team would be helpful. But no, we can't have a voluntary bylaw. There are voluntary programs in other jurisdictions that aren't in a form of a bylaw, that are voluntary and be promoted. So if council were to direct staff to do something voluntary, we would need to dedicate some resources to preparing that and getting that word out. But the direction in the amendment did say to defer the preparation of the actual bylaw until 2022, as per the motion that the staff brought, or the recommendation that staff brought. So there are voluntary programs, and that could be the direction of council. I don't know how soon we could have that up and running, or what effort it will take in order to do that. I would need some time to look at that.
Okay. Thank you, Commissioner Hughes, for that answer. And so, Councillor Hutchison, based on that answer from staff, I'm okay to allow it. So thank you for just helping to clarify what's that.
Just on that note, Mr. Mayor, so I would if it can't really be a bylaw without being a bylaw, I propose an amendment that we change the wording to voluntary program, in which case we could possibly get a voluntary program up and running right up until the bylaw actually occurs.
Thank you,
and through you, Mr. Mayor. So to Councillor Bohm's question, yes, that would be the simplest way to approach this, would be to actually change the language to a voluntary program, because bylaw does does obviously imply that it is a requirement and that we will enforce and penalize should people not be implementing the bylaw. So what we're talking about here is a little bit different. So voluntary program is the wording that we should be utilizing.
Okay, so with that, I would just propose a quick amendment that we use the wording.
Okay, just before you do, Deputy Mayor Holland, point of order.
Yeah, two things. I'd like to see it on the screen, and also I would suggest that it's still out of order. Given that the original motion that is the staff's recommendation is proposing a deferral of a bylaw, and so to change what was an original motion from a bylaw to a voluntary program seems to be out of order.
So, so a couple of points. First of all, let's put it up on screen first, and then I'll address your second comment, Deputy Mayor. Can we get this back up on the screen, please? Just need to see. Okay, so I have a comment. If I can just see everybody on the screen again. Okay, so Deputy Mayor Holland, so your point of order is that this is a recommendation to defer the bylaw. So I would agree, except if the amendment is to clarify it is a mandatory bylaw, and then if Councillor Hutchison accepts the wording of a voluntary program, then I would suggest that that amendment is in order, because it would still be deferring the bylaw, but it would be speaking to a voluntary program in the interim. So based on that ruling, so Councillor Hutchison, I'll allow the amendment if you are amenable to changing the wording at the end of your amendment from changing it to voluntary form of bylaw to voluntary program. Is that something that you is acceptable? That would be how I would be able to keep it in order.
Okay, first of all, I just want to be clear that I'm not sure I accept the idea that you can't have a bylaw that indicates a voluntary action.
Sorry, Councillor,
but
I can't quite hear you. Could you just say that again?
Oh,
can't quite hear you.
Okay. Okay, you can hear me, right?
I can hear you now.
Good. Okay, I just wanted to say that I'm not sure I accept the idea that you can't have voluntary action under a bylaw. But I'm trying to reach a principled compromise position here. So can I ask the two councillor, before I adopt that wording, I'd like to ask two questions, one each of Councillor McLaren and Councillor Neal, as to their acceptance or non-acceptance of that change.
So unfortunately, Councillor Hutchison, that's not something that is procedure in order. We can't shop around to see if something is acceptable compromise to other members of the council.
On the contrary, Mr. Mayor, this is right rules of procedure, which we just dealt with last week. Okay, that you can ask questions of your fellow councillors. Now I'll ask them one at a time if you like.
So. No, Councillor Hutchison, I'm sorry, that is not true. I do allow for questions of the mover of a motion that can answer questions of council. But this is a different scenario than that. What I would propose is that we go with the wording of voluntary program, and then people can speak to that amendment and give their perspectives about whether or not that's acceptable.
And you want to know whether it's friendly or not. So for the purposes of this.
So it's a little bit of a different situation than saying that it's friendly, because what I'm proposing is that without that change, the amendment is out of order. So what I'm trying to do is find a way to have your amendment be in order so that we can then discuss it.
So, okay, Councillor Bone made a suggestion. If I say fine, we're back on track, right?
So that is exactly right. And this goes back to Councillor Holland's, or Deputy Mayor Holland's point of order, that your amendment as is written is out of order. However, based on the suggestion of Councillor Bone, if we change that wording to voluntary program, then the amendment is in order and then we can discuss and debate it.
That's okay.
Okay, all right. So we have then that amendment. So just to be clear, if we can just if we could just change that wording, and then once it's corrected, we'll put that up on the screen, and then we can have a full debate discussion. So, Councillor Baum, you still do have the floor, so you can continue to speak to the amendment.
Thank you, Your Worship. And through you, I was just wondering, and this might help with some of Councillor Hutchison's concerns, is can we have the wording say change to a voluntary program in anticipation of a bylaw or something to that effect, so that the public understands that it's a voluntary program at this point, but we are working on a bylaw for the future. We may just give everybody a heads up. And I believe there was actually 2 spots if the wording was up there or actually need to be changed. I think 34 and then 1 at the bottom, but just we have to check on that with the clerks.
Okay, so what we're going to do is we're going to put up the wording first of all. I'd rather that people see this before we. I don't want to wordsmith further. We had to do it once just to be able to have something that's in order. But I prefer now to make it very clear what it is that we have in front of us. Okay, so what I'm going to do is I'm just going to read then what that paragraph would now look like. It would say the council directs staff to further defer the preparation of the mandatory bylaw to prohibit open doors and windows when air conditioning is in operation until Q2 2022, and that staff be directed to proceed in the interim period as soon as possible with a voluntary program. Okay, so this is the amendment that we're speaking to at the moment. So, Councillor Baum, you still have the floor if there's anything else you want to add.
Yeah, no, that's fine with me. The simpler is probably the better. I think people understand that it's in anticipation. So
okay, thank you. Okay, so we're speaking to the amendment. Next is Councillor Hutchison, or sorry, Councillor McLaren.
Thank you. So when we do a law or a bylaw, we don't have to educate people on why, we just enforce it. When it becomes voluntary, it's important that the individuals involved understand the benefits of voluntarily participating in a particular program. If we pass this, will there be an education program to those who may want to open their doors because they clearly would see a short-term benefit? Would they be educated on the long-term costs of that, both environmentally and to the burden that they are causing themselves and their neighboring businesses if they were to break the voluntary ban on opening doors with air conditioning?
Commissioner Hugelbos.
And thank you, Mr. Mayor, and through you. So absolutely, I think education and promotion is 100% necessary for any initiative that we want to do and impose on the community, whether it be a bylaw or a voluntary program. We will need to partner with agencies such as the Chamber and the Downtown BIA, Sustainable Kingston. We'll be asking for their time to help us reach out to their memberships. And yes, there are several benefits for cost savings and energy savings with this program. So we'll do our best to get that information out. There are some example programs like I think we may have mentioned, but definitely have mentioned in the report. So we'll draw some from lessons there. Should council direct staff to implement a voluntary program.
Thank you. Those are important reasons, but the one that you left out that I think is most important is the competition policy one. May I ask, do you understand the nature of the prisoner's dilemma and how it applies here? And if you don't, could I ask that you educate yourself on that? Because that should be the one.
So, Councilor McLaren, I'm a little uncomfortable with just the way you worded that.
I'm sorry.
It just didn't come across. I think could you try to reword that?
Certainly. Are you confident in your ability to communicate the competition aspect of this?
Again, staff will do our best to educate on the many merits. If council is directing staff to go tell business how to compete in the business world, then so be it. We will do that, Councillor McLaren. But again, we will do our best to work with our partners like the Chamber, Kingston ECDEV, and BIA, who are busy helping businesses through a number of things right now, and we'll ask them to help on those points of difference in this. And perhaps there are better people than me to impose upon businesses how they should be conducting themselves. So fair enough. Thank you.
Okay, I'm confident I'll support this.
Okay, next is Councillor Neal.
Thank you. I appreciate what Councillor Hutchison is trying to do here. My frustration, though, goes back to what I originally had said, which is this was one of the earliest motions passed by this council. It was deferred once, now it's going to be deferred again. And so virtually for the whole period, almost the full period of this council term, we have direction from council that isn't being implemented by staff, and that continues to be a frustration. And I appreciate what Councillor Hutchison is attempting to do, and I'm glad that he left in that this wasn't going to replace the motion, but the deferral is still there. So we will be going almost for a full term with clear direction of council not being implemented by staff. And I find that frustrating, and for that reason, I won't be supporting the amendment, although I appreciate the intent of the amendment. Thank you.
Thank you. I do see Commissioner Agnew with her hand raised. Commissioner Agnew, was there something that you wanted to add? Go ahead.
Thank you, and through you, Mr. Mayor. I'm sorry I had my hand up earlier in the conversation, but there was a bunch of hands up all at the same time. The one thing I just wanted to provide for council's benefit that may help to address some of the concerns about the deferral is there needs to be the recognition of the substantial amount of work and resourcing on the enforcement side we needed to put in over the last 15 months with respect to COVID. We're doing a lot of work. We will continue to do a lot of work. We've needed to staff up to provide additional support relative to the different pieces of legislation to meet the public health commitments and also the expectation of our constituents. And the other component to this too is that this set of bylaws that's being discussed, and I recognize that there's a discussion here about a voluntary program, is that it takes a lot of work, people on the ground doing this, that can take away from our resources that are allocated to priority work. So it's not a lack of willingness from staff, but also a capacity issue. And my team has been working, even though we don't enforce anything related to idling, that's actually the parking staff that do that. The parking staff have been working to step up and help my staff on the enforcement of all of the COVID-19 protocols, which have continued to increase. And our service has increased substantially over the last year in terms of the amount of service we're providing in terms of a 7-day detail from what was once a 5-day detail. So it's, there is that challenge there. And there was a question about that earlier in the process. And I wanted to make sure that I could provide that for council's benefit, that we are feeling quite constrained. And as Mr. Hugelboss indicated, one of the cornerstones of our enforcement approach is always education first. So certainly as part of any program, whether it would be a bylaw or a voluntary program at council's direction, education would be a first and foremost approach to make sure people understand what we're doing and why.
Thank you. So next on my speakers list is Councillor Stroud.
Thank you, Your Worship. Yeah, this amendment, I'm kind of ambivalent about the amendment, but I will speak to the amendment. I consider this amendment a red herring to the original motion. It has an effect, but it does not, in my opinion, change the direction of the original motion, which is a mandatory bylaw. And it doesn't change the effect of the original recommendation, which is a deferral. It's just adding another dimension that we may agree with or may not to a file that has already been deferred. And the intent of the amendment is obviously well intentioned, as Councillor Neal said, but it doesn't actually affect the original direction, which, as Councillor Neal also said, is direction from council to staff that is not being followed. Now, there may be valid reasons why enforcement of an anti-open doors with air conditioning running bylaw, there may be major enforcement issues with that if the bylaw were finished. But that's not even what's being addressed by this amendment. What's addressed by the amendment is the creation of yet another aspect that will consume more staff time, which would be a voluntary program. Okay, so now it's time to give a parallel thing, and I may run out of time, and it is in the larger picture, but the smoking ban that Canada started in 1997 with the Federal Tobacco Act, and then each province implemented smoking bans over the next 10 years. I think Ontario's was 2006. I remember this debate downtown. I remember the tavern owners and the restaurant owners saying, you take smoking out of our businesses and we're going to go under. I remember that very clearly. Pretty much every place that serves alcohol was saying that. And there was unanimity amongst the business owners. And yet what happened? We all know now, and it would be unthinkable to think, oh yeah, you can smoke in a restaurant. But yet that used to be commonplace until the ban. So that's what I consider the original motion to be addressing. The idea of air conditioning the open space with in the middle of an energy crisis is ridiculous. And that's what the original motion addresses, and that this amendment doesn't address in any way. The voluntary program will consume extra staff time. I believe it was well intentioned, but I will also vote against. Thank you.
Okay, next is Councillor Osanek.
Thank you, Your Worship. I'm voting against the amendment. COVID-19, it's derailed a lot of projects, not just the implementation of this bylaw, and it's just the way that it is, however unfortunate. I have to agree with Commissioner Agnew and everything she said. Like, how many emails have we gotten within the last week complaining about what our bylaw staff, needs to do to, keep Kingstonians safe, right? To, basically, keep the Queen's population under control. Like, I've received 7 emails just over the weekend about it. And all of that work falls on bylaw, whether it really is the Queen students out of control or it's just the variant that's spreading around. Bylaw has had so much put on top of them because of COVID. I feel sorry for them. I know that this bylaw was very important back in 2019. I know it, I get it. We had a very hot summer. It was hard to see all those doors open. But like our mayor said, right now is the wrong time to bring this on. However unfortunate it is to wait until the year 2022. So, and also with the voluntary program, you know, that we're talking about with this amendment, like that takes a lot of staff time as well. Like how for the businesses that will be closing their doors as part of this voluntary program, we'll have to do placards, right? Like we'll have to do signs for this voluntary program so that whatever business does intentionally close their doors, you know, can then advertise that they're doing this for the climate. Like that's going to cost money, and then that's going to cost time is money, you know, staff resources devoting to the voluntary program. I just think this summer's not the time to do it. And however unfortunate, I'm okay with waiting until next year in 2022. Thank you.
Thank you. So I do still have a couple of speakers to the amendment. I just want to clarify. You will have a chance to speak to the main motion once we deal with the amendment. So we can just try to direct you really to whether or not to include the voluntary program with the default. So next on my list is Deputy Mayor Holland.
Actually, no, I'm okay. I may speak to the main motion.
Thank you. Next is Councillor Osterhoff.
Thank you, Mayor Patterson. I would just like to echo Councillor Osanek. I will be voting against the amendment and to just support staff in the original motion. Deferral.
Thank you. Next is Councillor Doherty.
Thank you. And through you, Mr. Mayor, I have a question for staff. Clearly, the message from council tonight is that we're very supportive of the original motion, and that the bylaw is going to be introduced at some stage, hopefully very soon. So the question is about the amount of time and the burden to staff, because I also hear that loud and clear. But I just wonder if the Chamber and KEDCO and Sustainable Kingston, how they can help our local businesses move in the right direction now, because this bylaw is definitely coming. So what can be done without adding a burden to staff now, but that we're also heading in the right direction?
Sorry, Mr. Mayor. I just use the real hand, sorry. Thank you, Councillor Doherty, and through you, Mr. Mayor. So if I understand the question, like I said, we will definitely reach out to our partners, because the voluntary program and a future bylaw would be there for all business across the city, and it's a wide net to cast. So we do need partners. We need social media. We need to get the word out and support. Those partners are definitely very taxed right now with lots of work to do to support businesses. I do think there's a willingness here in the engagement feedback. There are several concerns, and we will work through those. And like I said earlier, we do need to go back and engage with business, because a lot of businesses have changed their model now because of the pandemic. So I don't think it would be fair to base the bylaw on feedback that was received over a year ago before the global pandemic. That said, I just do want to clear the air that staff is committed to council's motion. We will bring something back to council. It was my opinion as staff to make this recommendation to council to defer another year. I think the staff have worked very hard to engage, and there was some preparation done before the pandemic. Back in 2020, there will be more work to do to bring a bylaw should whether this motion passes the next motion, the amendments. If it is deferred until 2022, there's still lots of work to do, but it is not something we like to do, to say to council, we don't want to implement what you're doing. It's a deferral because we are recognizing the times, and as Commissioner Agnew said, the resourcing capacity that we have for enforcing a bylaw. So I just wanted to say that, and I do think, and I hope I answered your question too, Councillor Doherty, but happy to follow up.
So yeah, thank you. So you actually, so what you are saying is even this program would be too much of a burden, not just for staff, but also for the other agencies.
No, so sorry. If it's the will of council to direct to do a voluntary program, we will do that as soon as possible, as per the motion to amend. There are examples out there of these programs, but we will need to rely on partners, and those partners are also very busy right now. So how well we can do it right away, I don't know, to be completely honest with you. It's not something that we'd be able to roll out in a couple weeks. But there are good examples. It is a voluntary program, so we don't have to have every word right in a bylaw to enforce and define and do that sort of thing. But if it's the will of council to do that, we will implement a program and do our very best to partner with as many people that can help us to get that word out, to educate on the various aspects of why closing doors is a good thing, while at the same time protecting the health and safety of their employees and their business.
Thanks.
Okay, I don't see any other speakers for the amendment. So Councillor Hodgson, you have the last word on the amendment before we take the vote.
Oh, thank you very much, Mr. Mayor. There's a number of arguments here that are good, decent arguments on both sides of this. The thing that struck me when I heard from somebody said, wanted to know what the heck we were doing by deferring this. For the second time, as Councillor Neal said, it struck me that when we passed the climate emergency motion, we were elected in 2018. Climate emergency motion came relatively quickly after that. And are we making any, and now it's 2021. There's about a year and a half left of this mandate. And so the question is for us, we have to look at, are we achieving what we set out to do, what we declared in our strategic priorities, and in particular on the climate change emergency? Well, we have done some good things, I think. So it's not a clear landscape one way or the other. But this was one of the things we thought we could do. And so when my amendment, agreed to amendment with Councillor Bone, was that I think we need to show people and we need to actually move the dial. And so I'm asking council, voted on this and we're pursuing it, we need to show we're moving the dial. And that's what I'm hoping will come of this amendment, and the amended motion should have passed. So I encourage you to vote for it. Thank you.
Okay, thank you. So what we'll do now is we will call the vote on the amendment from Councillor Hutchison to add the voluntary program in the interim during the deferral. So we'll call the vote. All those in favor? Opposed? And that loses. So now we're back to the staff recommendation as not amended. Councillor Hutchison, you still have a minute on the clock if there's anything else you wish to say before I go on to the next speaker on the list.
I will just say that I'm going to have trouble looking people in the eye over this, okay? So I'm going to vote no. I realize staff have a lot of pressures and work, and I'm actually really sympathetic to that. But there's a point with political responsibility where you have to ask yourself, are we getting there? And this doesn't send the right signal. And so I was hoping to get a way we could move forward, not, but that's been defeated. So I'm left with the original motion, and I will not vote for it. Thank you.
Thank you. And next on my list is Councillor Bowman.
Thank you, Your Worship, through you. And unfortunately, I agree that the amendment would have solved some problems, but on the original motion, as it stands now, I think we do need to be cognizant. I do understand Councillor Neal's concerns and Councillor McLaren's and Councillor Hutchison's, but I guess there's other concerns that need to be factored in, and that is just the damage that has been done to small businesses through this. I know so many that are literally just barely holding on, and I think that Commissioner Keegan-Boss brought it up where, you know, we need to be cognizant of including them in this conversation. And the fact that I believe, as I try to be positive, that we would get so much further with incentivizing this and educating than we would with just imposing a bylaw and then having to pay people to chase people around and then play the little game of, oh, is bylaw, come and close the door? Are they gone? Okay, open the door. I think it's educating businesses, and this actually will speak a little bit to Councilor McLaren's point, where we should make businesses realize that the smart thing to do, the best business decision is to run with your doors closed, because that's going to mitigate so many different factors, and it's also going to cost you less money at the end of the day. And if we can show them that it doesn't reduce the foot traffic and show all the benefits that can come with it, I think that's a much better approach. In the grand scheme of things, though, I will support this deferral, and one of the reasons is that I do want closed doors, but I also don't want permanently closed doors. And I feel like if we don't do this in conjunction with the business community, that there's a real risk that some people are just kind of see this as, you know, the straw that broke the camel's back, or you know, the final straw, or the last little bit of thing that they can bear. And there's already so much pressure on small businesses. And I know that staff and the Downtown Business Association and all these things, we're trying to do everything we can to support them through this time. And we can't just pick one thing and pretend that COVID didn't happen, because it did, and it's still happening. And we are in the midst of the third wave of it, and we don't know how this is going to pan out. So, I mean, to really drop this on them at this point, I mean, it could possibly undo all the work we've done up till this point to support them. So with that in mind, I think this deferral, hearing more of the justifications from staff throughout this conversation actually does make sense. So I hope it passes, and I'll be supporting the deferral. Thank you.
Thank you. Next is Councillor Stroud.
Thank you, Your Worship. So I made some points earlier to the amendment that also apply here, but just for the interest of brevity, keep it simple. Look, either running your air conditioning with open doors is a good idea or it's not. In the opinion of this council, it was not. That was why we got so many votes in favor of an outright ban from the original motion. Now, it's one thing to pass a council motion, and it's quite another thing to have staff implement a bylaw. So that's what we're hitting bumps in the road with the actual nuts and bolts of the bylaw. That's what you're hearing loud and clear from staff. And I would say that if you follow pure logic, that was always going to be the case with a bylaw of this nature, and that pandemic or no pandemic, there's a significant amount of work if you want a bylaw that's going to be effective on this. But what we can't do is give the appearance that when we hit those bumps in the road, we can kick the can down the road, because that's exactly what all the major interests have done with climate change for the last 30 years. That's what has always been the case on every effort of any kind to be good to the environment. It always comes down to the argument of, but what about this? What about this right now? This is too much change right now. Let's look at it later. Let's look at it later. Let's look at it later. That's what this appears to be. And if you're just a regular Joe on the street, you hear that we kick this down the road another year, even if it's 100% logical from staff's point of view, it's contrary to what we set out in our climate emergency. It's contrary to the original motion, because either it's a good idea to do or it's not. there was never a time limit set on, I don't believe. And if there was, maybe it was unrealistic, but this work needs to continue. And it needs to continue under the current circumstances. And once the pandemic is over, we'll actually be back to very similar circumstances as we were before the pandemic, as far as who is allowed to go to businesses and who's not, and whether or not air conditioning blowing in your face on a summer day attracts you into the store or not. And you know, the pandemic's not going to change that reality, the perception of air conditioning the environment. And, you know, we've got to stick with what we originally said. And this deferral is not consistent with the motion. Some would even argue it's out of order with the motion, because the motion is asking for the bylaw work to go until it's done. So taking another year off with no work at all is a bad idea. So I'm voting against this deferral. Thank you.
Thank you. Next is Councillor Chappelle.
I would just like it known that I was not in support of this. The first time it came, I don't think we should be dictating businesses how to run their business. And I think we've discussed this enough. I'd like us to call the question soon. Thank you.
So, Councillor Chappelle, are you putting forward a motion to call the question?
I think most speakers have spoken, but I'm not going to do that. I'm just saying I'd like to get rolling with this meeting tonight.
Thank you. Next is Councillor Osterhoff.
Thank you, Mayor Patterson, and thank you, Councillor Chappelle, for that. I think I supported this back then, but the more we talk about it, the more frustrating I'm feeling that we're here and talking about this, and probably being the only businessman on council that actually has doors that I have to have closed, or if they're open, or if they're closed, I have my heating or cooling able to shut down. So, you know, businesses are smarter than this, and I just think that we should move on and accept staff has asked us for consideration and respect that. I think that we've seen that the numbers are showing that there is a high, you know, really the percentages are very, very small that, you know, that are not going to, you know, you could do it as a volunteer and yourself, just go door to door and ask business to put a sticker on their windows and not cost our city any money, and be a, you know, a thorn to our businesses. That I'm almost embarrassed for this bylaw, because we always want to hide it behind climate change and all that. Our businesses do an awful lot, have made so many changes. I think that we should just, I'll say, call the question, Mayor Patterson, but let's be supportive of our businesses, and that they know what they're doing, and they don't want to pay the high bills, and they recognize their responsibilities very, very well. And so I just think that we should respect the staff at this situation, understanding that everybody's doing their best in a very difficult time. Thank you.
Okay, so Councillor Osterhoff, I'm going to ask this, are you putting forward a motion to call the question, or are you just saying that we should just get the vote? Because those are different things.
Yeah, I'll let the others people speak, but I wish we would, yes.
Okay, so I have two more. I believe there's only two councillors that have not spoken, maybe three. So I have two more speakers on my list. First is Councillor Doherty, and then Deputy Mayor Hall. Councillor Doherty.
Thank you, and through you, Mr. Mayor. Look, we often and almost, it's been a real frustration for anyone who cares about action on climate change that the economy always seems to trump climate change. And the reality is, just because we have a pandemic doesn't mean climate change has gone away. In fact, it hasn't, and it's escalating. Having said that, I think some of the comments that Councillor Stroud made, whether we have the pandemic or not, we would have had hurdles, perhaps we would have, but the reality is that we do have the pandemic. The reality is that, yes, this is a good idea, but we have a pandemic, we have bylaw staffs who are just overworked at the moment. We get, as Councillor Osanik so correctly stated earlier that we get emails from residents all the time about bylaws. Why aren't bylaws here and there and absolutely everywhere at the moment? And I think we cannot ignore staff's concerns and keep loading them up with extra work. And also, I would hate to see the signs that we already have a lot of businesses that are going to close because of the pandemic. And now we're asking them to close the doors, which is really important. And I hope that we can do something that to encourage the doors to stay, to close when air conditioners are on. But we don't want any doors to close permanently. And I think the message to our local businesses that employ local people, we want them to know that we support them. So we're going to ask them friendly to please close their doors in the summer when the air conditioner is on. But I am very reluctant. I can't support forcing this on them at this stage. So I am reluctantly, but I am going to vote for the deferral.
Thank you. Next is Deputy Mayor Holland.
Thank you, Your Worship. And I'll just take one moment to speak to the public engagement part of this conversation. We've talked about a number of different variables. I haven't gotten the impression from the report or from any of the discussion tonight that there's just any one thing that's really at play here, but a lot of complicated variables. And most of them related to the timing. Therefore, a deferral does seem appropriate. And I think mostly in terms of engagement, because if we are looking for education, then that requires businesses to be a part of the conversation about reducing emissions and all of that. And that's, I think that work is really valuable and I want to see it happen. And I think that was a part of the original motion. You know, yeah, we want to see the outcome, but we also want to see that work, you know, in a bigger picture in the community. And I think the fact that doing a survey right now and getting input right now from businesses is a terrible idea. We honestly don't even know which ones will exist. And that's a horrible thing to even think. But the discussion isn't so much around bottom line versus climate. It's about, like, practically speaking, how do you figure out a way forward when we're in such a strange moment for our businesses in the city? So taking a bit more time, doing the real work of consultation seems the most appropriate way forward. So I'll support the deferral.
Okay, so we will, I don't have any other speakers, so we will call the vote then on clause 2. All those in favor? Opposed? And that carries with Councillor Hutchison, McLaren, Neal, and Stroud opposed. Okay, we still have a fair ways to go in this report. And so just looking at our time, we'll take a 10-minute recess and then we'll reconvene at clause number 3. We'll reconvene at 9:17. Okay, folks, it's 9:17, so we will reconvene, just verifying that we have quorum. Just need one more. There we go. Okay, so now we'll move on to clause 3, the Community Investment Fund 2020 funding recommendations. Point of order, Councillor Doherty.
So my Wi-Fi kicked me off just before the last vote. And so what's the protocol? We talked about all the technology at our meeting, recent special meeting, but we didn't, I don't know if we have, I don't understand what happens before a vote when we get kicked off.
So, the deputy clerk actually had your vote in favor. So I'm not. So I think we did catch in time. In general, though, to your question, Bylaws, if that happens, I mean, sometimes that technology has happened even when we were in person in council chambers. So we can always do a revote. But I think in this case, your vote was counted.
Okay, thanks.
Okay, great. Any discussion on clause 3, Community Investment Fund 2020 funding recommendations? Yes, Councillor Stroud.
Actually, Your Worship, while we were on recess, I realized I still had to declare my pecuniary interest. It's the closed session item number 1A, negotiations with ONA. Here, do you want me to read the exact wording of the clause? I just have to go back to it.
No, we know it was the first clause from the Committee of the Whole closed meeting.
The closed meeting 1A from the regular agenda.
Yes.
Labor relations or employee negotiations, ONA negotiated settlement, received pecuniary interest as I am a member of the Ontario Nurses Association.
Okay, thank you. And that has been noted by the deputy clerk.
Thank you.
Okay. Is there anybody else that wishes to speak to clause 3? Councillor Doherty.
Thank you, and through you, Mr. Mayor. I wonder if we could hear a little bit about the criteria. I was not that particular. I was just wondered why, for example, the YMCA received funding for an HVAC system and addiction and mental health was turned down at a time when we have so many concerns regarding mental health. So and I'm sure that there was a good reason for it, but I just wonder if we could have a bit more of an explanation regarding the criteria.
Okay, Ms. Nordegraff.
Thank you, and through you, Mr. Mayor. I also have Ms. Hitchen on the call. So she has been part of the process and would be much more capable of answering that question.
Ms. Hitchen.
Good evening, Council. Through you, Your Worship. The criteria for the Community Investment Fund haven't really changed since the United Way and the city partnered on it. I think it's been now 10 years or close to 10 years. Basically, we're looking for projects that are impactful for our community and make it a better community to live in. That's a very general statement. They also need to fit within the city's strategic planning goals and also the United Way priority areas, which are from poverty to possibility and making the community better for children. And there's a third one that off the top of my head, I can't remember what it's called. I'm sorry. But the Community Investment Fund uses volunteers. So the criteria are weighed against the application on paper, and then the people applying also do presentations to the committees. Obviously, this year we did them all by Zoom. So to answer your question in terms of why one and not the other, it was a combination of the quality of the proposals, the impact it was going to have as described by the proponents, and also the presentations that they did. So all those things are weighted, and the outcome is before you tonight. There were no proposals that the committee felt should be funded, but we didn't have enough money to fund. So you can be confident that it wasn't a funding maximum. The United Way and the city worked together on making sure that all of the proposals that the committee feels are worthy of funding receive funding from one source or the other.
CEO Hurdle.
Thank you, Mr. Mayor. And I just wanted to add to your question and your concerns, Councillor Dorothy, in terms of the mental health. I completely agree that it is a challenge and a significant service as we have been going through COVID-19. So I just want to point out that Council did approve additional funding for 2021 for social services as it relates to try to better address some of the needs and impact of COVID-19. So I think what we can expect to see is some of these initiative and services to definitely be have higher consideration through that process.
Okay. Seeing no other speakers, we will call the vote in on clause 3. All those in favor? Opposed? And that's carried. Clause 4, approval of a single source agreement with Nimble Information Strategies, Inc. for electronic document management. We'll call the vote. All those in favor? Opposed? And that's carried. Okay, number 5, City of Kingston grant strategy. All those in favor? Opposed? And that's carried. Clause 6, Provincial Audit and Accountability Fund, Intake 2, Transfer Payment Agreement, and related procurements. Okay, all those in favor? Opposed? And that's carried. Number 7, Financial Oversight Responsibilities. Councillor George.
Thank you, and through you, Mr. Mayor. I want to thank staff for the detailed report and giving information on 18 different municipalities. I thought that was really great. And I just wonder when the report, the more detailed report goes to committee, if you could also include what kind of rating each municipality has for the Standard & Poor kind of rating and how they compare. Just want to get an indication of their financial management.
Ms. Kennedy.
Thank you, through you, Mr. Mayor. So yes, we can certainly take a look at that. Some of the municipalities, particularly the ones that we have listed there, some of the smaller ones do not have a credit rating. They choose not to do that. But certainly for the ones that do, we can find out what those are and include that information.
Okay, we will call the vote on clause 7. All those in favor? Opposed? And that's carried. Then clause 8, major policy planning projects status update. All those in favor? Opposed? And that's carried. Okay, on to report number 35 from Planning Committee.
Moved by Councillor Neal, seconded by Councillor Osanek, that report number 35 from the Planning Committee be received and adopted.
Okay, so there is just 2 clauses. Would anyone like the clauses separated? Okay, seeing none, we will vote on them as a whole. So clause 1 is approval of an application for zoning bylaw amendment 180 and 182 Bagot Street. And clause 2, approval of an application for zoning bylaw amendment 190 and 198 Resource Road and 1315 Centennial Drive. All those in favor? Opposed? And that's carried. Okay, on to report number 36 from the Arts, Recreation, and Community Policies Committee.
Moved by Councillor Hutchison, seconded by Councillor Osanek, that report number 36 from the Arts, Recreation, Community Policies Committee be received and adopted.
There are 3 clauses in the report. Would anyone like to separate any of the clauses? Oh, yes. So thank you. We're going to separate clause 1 for Deputy Mayor Holland's pecuniary interest. So what we'll do is we'll deal with that then right now. So number 1, local food strategy and amendments to the Kingston Public Market Bylaw. Councillor Doherty.
Thank you. And through you, Mr. Mayor, I wonder if we can change, I think it's, point 7.3, where it states that when we had special events that we would give 4 weeks notice, and that would be amended to 6 to 8 weeks, if that is possible. We heard earlier about the importance of obviously meeting there, offering the dates during the growing season, but if we could stretch it to 6 weeks, that would be better for
CEO Hurdle.
Thank you, and through you, Mr. Mayor. So I know this has been a topic of conversation actually through our various consultations that we've had for this particular change to the bylaw. So the bylaw currently provides for 1 week notice period. And that's been in place for a number of years, actually, the 1 week notice period. So in our review of the bylaw, we wanted to obviously work with our producers, local farmers, but we also have been, as you know, working with our partners at Tourism Kingston that have been actually quite successful in attracting through the film office different filming opportunities, which again is part of the strategy that has been endorsed from a tourism perspective. So in trying to find some balance, and what we heard from obviously the film office is that when we get into 6 to 8 weeks, it becomes very challenging to be able to attract any kind of filming activity if we have that kind of time frame. So the 4 week is something that they felt was doable. And we also looked at it as, actually moving the needle from 1 week to 4 week, which is substantial in terms of a change for the notification period. I do want to point out that we have made some changes as well in terms of the way that the film office works with the vendors on the market. So I recognize that a number of years ago, there wasn't maybe the type of collaboration that there is now. And we saw that actually recently with the Lock and Key production that took place in the square. I believe it was during the fall. So I would be reluctant to see a change there. I do think it would impact our ability to attract filming opportunities, but ultimately it is council's decision. We did try to find a compromise and a balance between the different interests while substantially increasing the notification period for the vendors.
So is it possible to ask the film office to notify even earlier than 4 weeks, if at all possible? Like, because I'm sure when there are productions, you probably most of the time know way beforehand that the production is coming into town, right? So, but perhaps all effort can be made to have it actually longer warning than 4 weeks.
CEO Hurdle.
Thank you, and through you, Mr. Mayor. So we can ask if where possible, that they provide more notification. I can tell you, having been involved with some of the last minute production that have taken place, not necessarily in the square, but at Kingston Penitentiary over the last year, some of them would get decided within a 2 week period. So it's not always something that, very long time before the production actually comes into town. Sometimes their decisions are last minute.
That's good for us to know.
Okay, is there anybody else? Councillor Ostrom.
I'm sorry, Mary Patterson. Could I just have a few comments or a question on the bylaw for open fires? Can we have it broken out?
Okay, so yeah, what we're doing is we're just dealing with clause 1 right now on public markets. So we will get to number 3 in just a few minutes.
Thank you.
Yeah. Okay. Is there anybody else that wishes to speak to clause number 1? Okay. We will call the vote then on clause 1. All those in favor? Opposed? And that carries. Okay, clause 2, art in public places working group, updated and expanded terms of reference. All those in favor? Opposed? And that's carried. And now number 3, bylaw to regulate the setting and maintaining of open air fires. Councillor Oosterhoff.
Thank you, Mayor Patterson. And yeah, not a lot to say there, but I just appreciate the work that has gone into it. And I appreciate the fire chief's involvement and how they engaged the community. I thought was very effective and willing to listen and to be flexible on this. And I understand that it's up to the fire chief actually to any fires at all. And so when he educated us, we really understood a lot as well. And so what I really appreciated about this work and this bylaw was that it did recognize the two areas, the urban and the rural area, which was very helpful. And I've actually had the farming community reach out to me and express thanks for that kind of thing so that they could actually do the work that they needed to do. And do we actually have one of the fire chiefs here? We do. Okay, I don't see. Okay. Hello, Mr. Fire Chief Armstrong. How are you? The question I had just yesterday was related to farms are allowed to have more than one fire. If it's, is that because you had a certain size with so many meters of fire for brush? Is that what it was? I think. How did you end on that one? Did I miss that?
Through you, Your Worship, we were able to increase the size of rural fires substantively, and anything that was in excess of that size was also subject to the potential for an inspection. So we were very flexible with the rural fires, and we wanted to make sure that it was just being conducted in a safe way. If somebody wanted to have a fire that was larger than the prescribed fire in the bylaw, we would certainly work with that resident to make that happen as safe as possible.
Well, that's excellent. And I just wanted to reiterate what I've heard through the rural community and the appreciation from Rural Advisory 2 and coming twice, and that kind of engagement and recognizing the differences between the urban and the rural area and embracing that and facilitating that was commendable. And I want to thank you for the work that you've done.
Okay, thank you. Councillor Chappelle.
Yes, thank you, Your Worship. My question is really about chimeneas and those small little backyard, little open fire event systems. Does this require now to have a permit, and will that type of urban fire pit be permitted in the city of Kingston underneath this new bylaw?
Through you, Your Worship, yes, it would be. It's as long as the appliance is approved within that zone, which would be the zone 2 of the bylaw. Obviously, as was raised in the arts reputation at the Arts Committee, was really around the fire. If it was becoming a nuisance to the neighbor, we would certainly have a visit and try to resolve that issue in a way that was flexible and would seek compliance through voluntary measures. However, if the fire continued and it was a nuisance, no matter whether it was in a approved container or just in a fire pit, we would certainly make that, enforce that compliance and make that fire go out.
Okay, thank you.
Councillor Bone.
Thank you, Your Worship, and through you, I just want to thank Chief, you and your team for the effort on this. I know that there was quite a bit of consultation, and I was wondering if you could just touch on what seems to be a preference coming from the community, which is that there's always the education component first in any changes on this. I was wondering if you just briefly touch on that.
Part of our appraisal in the bylaw, through you, Your Worship, was really the fact that you can't have a fire in a community without establishing a bylaw. So the Council of Municipality needs to establish a bylaw that permits these types of fires. Obviously, we've had past internal practices that has allowed informally fires since 2013. Having said that, we understand that there will be a period of time where we'll work with the community to transition towards a deeper understanding of the requirements in both the rural zones and the urban zones of the city of Kingston. And we look forward, very much look forward to that engagement with the community. I'm very proud of staff. They did 12 weeks of public engagement, and we were aided by cultural services and communications and customer experience staff. So we did a really deep dive into the community around the needs, while also respecting that in doing so, we wanted to have it as safe as possible. An unintended consequence of the COVID-19 pandemic was that more people were at home enjoying their properties and having these types of fires, which increased, almost doubled our responses to complaints. So that we feel that this bylaw will not only be a vehicle for compliance, but a vehicle for education, and we intend to do that over the next year.
Chief, I know that any change is naturally resisted, but this is a testament to how to do change properly, and you and your team did a great job on that. On behalf of the community, I've had so many different comments that have been passed on. They truly enjoyed the process, and they really bought into the process that they brought forward here. So thanks again for your effort on this.
Thank you. I mean, all credit goes to the staff and Chief Fire Prevention Officer Ted Pozadowski and Deputy Chief Donaldson worked with the community. We actually had a very good relationship and consultation with our Indigenous community, and we learned a lot, and we feel those learnings will continue over the next 12 months to respect sacred and ceremonial fires.
That's great. Thank you, Chief. So with that, we will call the vote then on clause 3. All those in favor? Opposed? And that's carried. Okay, moving on to report number 37 from the Municipal Accessibility Advisory Committee.
Moved by Councillor Neal, seconded by Councillor Holland, that report number 37 from the Municipal Accessibility Advisory Committee be received and adopted.
So there's just the one clause, 2021 work plan. We'll call the vote. All those in favor? Opposed? And that's carried. Report number 38 from the Rural Advisory Committee.
Moved by Councillor Osterhoff, seconded by Councillor Bone, that report number 38 from the Rural Advisory Committee be received and adopted.
There's just the one clause, Rural Advisory Committee 2021 work plan. All those in favor? Opposed? And that's carried. Okay, we have nothing from Committee of the Whole. We have some information reports. If you have a question, just raise your hand as I read through them. Number 1, Strategic Plan 2020 Year-End Update. Number 2, Quarterly Report, Kingston Economic Development Corporation, Q4 2020. Number 3, Social Assistance Recovery and Renewal Plan. Councillor Hutchison.
Thank you, Mr. Mayor. I just got a couple of questions about what's actually happening here. When they talk about risk-based eligibility review for those in social assistance, what do they actually mean? What does that phrase mean? Please.
Thank you. Sorry, finding my mute button here. Through you, Mayor Patterson. So there really will be a shift with this social renewal kind of rollout from a lot of administrative local work to more of a risk-based, as to your question, approach, mainly through the provincial level. So we're moving away from a lot of the in face-to-face and paper, a lot of paperwork and wet signatures that are coming into the office, and there will be more of a digital approach with paperwork and pieces being uploaded. So obviously, you know, the kind of the shift from moving from really needing all the different pieces of paper and the signatures to really kind of working with clients and looking at the needs of the clients and moving away from the administrative burden, which will be really moved to the provincial level. Again, it's really in the midst of rolling out pieces, and you might have been reading in the reports various tools and kind of initiatives that we're rolling out, ranging from electronic document management to implementing other digital solutions to digital payments. So those are all pieces that come into play with that rollout.
Right. What I was really getting at is whose risk? The risk to whom?
Thank you, and through you, Mr. Patterson, thank you for clarifying that. So it's the risk of obviously the social assistance, that the allocation payments and its eligibility determination. Again, and you've seen in the appendices of the report as well, the various numbers of caseloads and the various income levels that we provide to people in receipt of social assistance. So it's the eligibility determination and the way that the eligibility is determined. Again, utilizing more digital tools to do that rather than a person.
Okay. So the financial part, as you said, that's what they mean by centralization of financial assistance. That'll go more towards the province after, well, eligibility seems to be part of it as well. So the local end of that is simply diminishing, disappearing. Is that correct?
I'm sorry, I didn't catch the last part of your question.
So when they talk about centralization of financial assistance, what they are really saying is that the local input as to eligibility and assistance is disappearing. It's diminishing.
Thank you. Yes, thanks for clarifying, and through you, Your Worship. That is correct. As in the report we've indicated, there's already a pilot and a rollout of a more centralized intake process of people applying for social assistance on a provincial level. And there's a first kind of layer of eligibility that's happening on the provincial level. If there's more of a complicated file, then that still will come to the local level to work through the eligibility check. But yes, there's really a move towards some kind of more administrative pieces moving towards the provincial level. So on a local level, we can actually focus on the life stabilization and case management work and really focus on supporting our clients in their stabilization and their system, system navigation.
So does that mean like the costs are reallocated at the local level, or increased or diminished?
Thank you for that question, and through you, Mayor Patterson. So the one thing that we know, based on a few of the service managers that have been part of the employment transformation pilot and are a little bit ahead of us, we have seen a reduction in some of the funding for those pilots. But that was really because the employment kind of component was moved out of their deliverables. We, again, as identified in the report, have not received any specific financial kind of information for our allocation. But we, and again, we are, based on the many conversations we have with other service managers and the broader kind of system vision of the province, are looking at more of a shift of how we're doing business and really refocusing the work on working with clients and moving away from more of the administrative work. We don't, like I just kind of referred to, we don't have a specific funding implication at this point.
Okay, so bottom line is I'm looking to see if the recipients will get a better supports, better opportunities. Sometimes when centralization takes place, that does not happen. So that was generally the drift of my question. Thank you for your answers.
No problem.
Next is Deputy Mayor Holland.
Thank you, Your Worship. So 2 questions, I guess. So it's an area that is rather heavy with the jargon, and so just trying to clarify for the sort of end user, to borrow some more jargon, what would it look like for someone entering into, say, 362 Montreal Street and looking for support under this new system? What would our people be doing, and what would the expectations of the client, what should those expectations be when they walk in the door?
Thank you for that question, and through you, Mayor Patterson. Well, first of all, apologies for the jargon. There's lots of acronyms and we'll not quiz you on those. So we are, I think we're quite excited about kind of the vision of this social services renewal process, because I think it is really focusing on integrating services, on better access, on different access of services. So to your question, for instance, maybe people don't even need to go to our office, and we might be able to have multiple access points for services. We also want to make, again, the administrative burden much more straightforward. So, for instance, having to come into the office to sign paperwork is something that we really obviously want to move away from, and utilizing the digital tools and have a two-way kind of way of communicating with clients through a centralized system. And again, catering to the various needs, because no client has the same, needs. Some people may want to have that face-to-face interaction, and we still want to obviously cater to that, and maybe have multiple locations in the community where we could provide that service. And other clients may want to benefit from the opportunity right now in COVID, where we are meeting with clients remotely or over the phone. So I think the type of service and how they can, or how the service can be accessed, will definitely, we have the ability to change and to really look at clients, what works best for the clients that we support. And kind of to the previous question, obviously we're also really looking at a way of more of a one-stop shop. Obviously, this will be a phased rollout, but ideally at the end of this, when we have implemented this fully, the idea is that we also will be able to support every client in the community that is in some sort of need or crisis. So it does not necessarily have to be a client that is eligible for social assistance. So I think it's really, again, looking at that wraparound approach where we can, as staff, really help to navigate the system, access the various elements of the system, and not ask clients to have, shared our stories multiple times with multiple staff, either within the city or at other agencies. And again, the last piece is really kind of, again, focusing on that system navigation and support, and focusing less on checking off the different boxes of needs for paperwork and next steps. I hope that answers your question.
Yes, it does, and thank you. And I know that the jargon is just industry specific. It has nothing to do with anyone's desire to use it here. But the actually that was a great response to the question, and you even set me up for my next one, which was about ticking of boxes. So there's always a fine line in the social service field between accountability for public funds and the frontline experience of having to demonstrate outcomes and close cases, etc. So is there do you know at this point, is there some sort of mandated time period for life stabilization, for example, if that is the sort of the main piece of the work that we're doing locally?
Thank you. And through you, just to clarify your question, you're specifically asking about outcomes for life stabilization, and if we have a sense of what they would look like, or when life stabilization would be rolling out in Kingston.
Actually, more the first question, and like if you have a sense of what that will be and whether it looks like it will be an onerous process. It's not so much about how onerous it is for staff. It's that if it is problematic if it becomes the end goal to, it seems that there's a suggestion here that more time is needed for many clients to be employment ready, but that recognition seems to be apparent in the report, but is there some sort of clock that starts at a certain point that you're aware of?
Thank you, and to you, Mayor Patterson, thanks for clarifying. The things we know at this point is and as you can appreciate, life stabilization is a pretty big kind of term, and incorporates many things from supporting clients with basic needs and life skills and health and overall community support. So we don't have a really clear kind of list of sets of items that we would need to check off, to your point. And again, I do think that's a little bit premature at this point. The one kind of table that we sit at is obviously the 47 service manager table, where these kind of conversations are rolling out. We are, again, looking at some of our other partners that are rolling out their employment transformation and have started with some of the life stabilization work, really in a pilot model to see what that looks like. So unfortunately, at this point, I cannot give you any specifics on these are the outcomes or timelines, or for basic needs, we need to do these 5 things, and for health, these are the 5 things. The one thing as well, and I think this makes the process actually quite, positive and tailor-made to the communities. Service managers also seem to have some local discretion in how to roll some of these pieces out. So there will certainly be outcomes and expectations, and I'm sure we'll be back in council to update you on those when we have a little bit more of an understanding of those as well.
Thank you.
Okay, thank you. So moving on to information report number 4, Bill 257, Supporting Broadband and Infrastructure Expansion Act 2021, first reading. Councillor Doherty.
Sorry about that. Thanks, Mr. Mayor. I did have a question about the previous information item.
Okay, I apologize. Yeah, go ahead, Ms. Nordergraaf, if you're still there. That's great.
Thanks. So yeah, thanks for the report. So I had similar questions to Councillor Hutchinson, but you answered them really well. There is one really serious question, which is a real concern for our community and Ontarians across Ontario who've lost their jobs during the pandemic. And Exhibit C of the report states that when federal benefits end, Ontarians who remain out of work are likely to turn to Ontario Works. Now, Ontario Works, for a single individual, which locally is 62% of recipients, the basic allowance is $303 plus another $390, totaling $733 for shelter costs. And a one-bedroom apartment in Kingston is $1,200. So, and that wouldn't necessarily include electricity or utilities, not to even mention that people have to have food and other necessities of life. So affordability is an issue that we're all aware of, and more people have lost jobs due to the pandemic. And also we've had recent announcement of 300 people losing their jobs at StarTech. So have you or staff, anybody heard anything about what kind of support is going to the province's, like financial support that province is talking about, or maybe introducing to prevent homelessness from rising in communities across Ontario?
Through you, Your Worship, thank you for that question, and thank you for obviously raising a very important piece. And as you might have seen in the exhibit, we have seen a reduction of our caseload last year, and we do suspect that obviously that is because people were able to tap into some of the federal benefits. And it certainly is a concern across, and not just for Kingston. I think it's a broader conversation to your point. And as far as I'm aware, I have not heard any specifics around social assistance and the potential, impact of people that have lost their jobs due to the pandemic. It certainly is something, again, that we are thinking about locally as much as we can provide. I mean, obviously, we are bound to provincial guidelines for income limits, etc. But it's certainly something that I think we have to be aware of and need to try to problem solve. Again, I think it is really a combination between the various elements of the departments, or of the corporation, even between our housing and our social services kind of portfolios. I wish I would have the perfect solution, but I don't. It's certainly something that we're very aware of and is being, I think, raised at many different tables when we have conversations with provincial ministries.
Thanks.
Okay, thank you. So we will continue on. I didn't see any questions for information report number 4. So we will move on to number 5, 2020 Statement of Remuneration and Expenses paid to council members. Number 6, tender and contract awards subject to the established criteria for delegation of authority for the month of January 2021. Councillor Chappelle.
Thank you, Your Worship. I have a number of questions, actually. Just let me... I'm just wondering about the purchase and delivery of 12 light-duty electric vehicles. With Petrie Ford coming in at $245, the contract was awarded to Kia Canada at $264, and I'm just wondering why that would be the case.
Mr. Kidd.
Through you, Your Worship, and thank you for the question. There's actually 2 awards. One is to Petrie Ford, and one is to Kia Canada. So the Kia Canada award is for any vehicles, for electric vehicles, and the Ford award is for any vehicles that operationally the electric vehicles, just the specifications of them won't meet the needs. So some trucks and things like that in our light duty fleet. So that's why we have 2 separate awards.
Okay, thank you. I'm looking in all of the Bell mobility costs, and I know that we recently had all the Motorola requests in the budget, some increased cost with regards to financing the communications, yet I've got maintenance for a wireless PS2 radio system, ongoing wireless full site safety program and monitoring. Again, there's this Kingston Fire and Rescue CAD annual support to Bell Canada. Lots of money. And I'm just wondering, why doesn't this come into the budget, or is this part of the budget and now is coming out as an expense? Because we passed the budget in January.
Sure, Joyce.
Thank you, through you, Your Worship. So that is all within the budget, Councillor Chappelle. It's an annual thing. It's part of the entire radio system and the computer-aided dispatch system that we have at Kingston Fire. So it is a budgeted item all the time, every year.
Okay. And then my final question with regards to expenses that came through, a flood remediation at 805 Ridley Drive. This is a building that we purchased and we've continued to put in money, substantive amounts of money. So two questions. One, is this, can you describe what that remediation was related to? And two, is this functional, this building yet? Is it being utilized yet?
Mr. Joyce.
Thank you, and through you, Mr. Mayor. So what happened at Ridley was years ago, many years ago, there was a fire in the building, and there was a pipe that was, I would say, impacted at some point during that fire many years ago. That let go during the freeze cycle and caused flooding. So all the work that happened out there was to remediate that very quickly to prevent mold and mildew from occurring in the spaces there. And the intention is, and certainly Ruth could probably speak to this a bit more, but the intention is that that site could be used as an isolation center for individuals that need that space.
Mr. Ruff.
Sorry. Through you, Mayor Patterson, yeah, in addition to Commissioner Joyce, the site is available. We have held that site available for outbreak management. As Council might recall, we have multiple scenarios in place for different potential outbreaks in the shelter. We also have the potential of moving a shelter over to Ridley for a short term. And we have recently, actually about 2 weeks ago, have put out a request for proposal for our providers to provide us with more longer term plans for the sites. And we will keep, as always, Council updated on any progress on that location.
Just while you're, Ruth, Mr. when does that proposal close for opportunities? Is it open to the private sector, or is it just for social service sector?
Thank you for that question through you, Mayor Patterson. I do apologize. I don't have the dates in front of me, but I can get back to you on that question, as in when it closes. It certainly is open for partnership proposals. So we do welcome various proposals.
Thank you. That's all I had, Your Worship. Thank you.
CEO Hurdle.
Thank you, and through you, Mayor Patterson, I just want to clarify that yes, the private sector can definitely submit a proposal if they're interested in operating supportive housing. We would be entertaining your proposal like any other agencies for social services.
Okay, thank you. So with that, we'll move on to information report number 7, Third Crossing Quarterly Update Q1 2021. Okay, we have no information reports from members of council. Miscellaneous business. Number 1, that as requested by Tiffany Coomer, Ian Potts Foundation, that council proclaim November 2021 as Complex Regional Pain Syndrome Awareness Month in Kingston. Can I have a mover and a seconder, please? Moved by Councillor Chappelle, seconded by Deputy Mayor Holland. All those in favor? Opposed? And that's carried. Number 2, that is requested by Natalie Lintner, Aprexia Kids. Council proclaim May 14th, 2021 as Aprexia Awareness Day in Kingston. Can I have a mover and a seconder, please? Moved by Councillor Doherty, seconded by Councillor Bone. All those in favor? Opposed? And that's carried. Number 3, that is requested by Tess Whitman, Sustainable Kingston. Council proclaim the week of April 18th to April 25th, 2021 as Pitch in Kingston in the city of Kingston. Moved by Councillor Rosanek, seconded by Councillor Neal. All those in favor? Opposed? And that's carried. Okay, on to new motions. We have one new motion tonight, moved by Councillor Hutchison, seconded by Councillor Rosanek. Whereas Kingston strives to realize the vision of being Canada's most sustainable city and that green natural burial is in line with this vision, and whereas natural burial includes these tenets: no embalming, no vault, the bodies to be buried in a biodegradable casket or shroud, leaving the above ground area with minimal environmental impact and also restoring natural habitats. Whereas there's currently no natural burial option available in Kingston in either a hybrid or standalone cemetery for those who are seeking this option. Whereas Kingston may be the first city in Ontario to have a standalone natural burial cemetery. Therefore, be it resolved that the Council of the City of Kingston direct staff to review best practices from other municipalities on the establishment of a natural burial cemetery within the City of Kingston. That based on the findings and or new research required that city staff investigate the establishment of a natural burial site within a city-owned or privately owned cemetery and report back to Council in Q4 2021. Okay, Councillor Hutchison, you have the floor.
Thank you, Mr. Mayor. So this, I think the motion is pretty self-explanatory. So I'll be pretty brief. The green burial motion is in line with our climate emergency motion. It seeks to allow people the option, the choice of having a burial option that is more environmentally and climate friendly. You can see what the tenets are there, and essentially people would be buried in biodegradable materials and perhaps a tree planted over them, wildflowers planted. The point is that it would be in a natural, wouldn't involve chemicals or other toxic materials. And the person could, or their family could, have them there, and they would basically go back to the earth and support the environment around them. And so this motion is essentially to bring the option or the choice to those who would like to access this. It would involve, I think, made clear in the meeting with me, that would probably mostly involve land in or adjacent to an existing cemetery. So this is not about actually doing this. This is about having a report done that would tell us, what the opportunities are in Kingston. And this is something that's being done more and more, actually, in different places across the province. So this is just Kingston getting in and trying to figure out how it could be done here. I'm happy to answer questions. It might be more clarifying, but essentially you're left with a park of sorts that could be used by people on much more easily than, say, as cemeteries as they're done now. It's not indicating any negative approach to other customs or traditions that people may have. It's just about supplying possibly another option. Thank you.
Okay, thank you. Is there anybody else that wishes to speak? Councillor Chappelle.
Yes, Your Worship. I actually engaged with the fellow that brought this to your attention, Councillor Hutchison, and made arrangements for him to have a conversation with the Cataraqui Cemetery. And the Cataraqui Cemetery has informed me that they do have space available to facilitate this type of burial service. And I'm hoping the staff does utilize the great assets that we have in that national heritage site in Cataraqui Cemetery. And that is my hope that maybe staff listening to this would acknowledge that this is available. I'm not necessarily supportive of establishing a new plot of land for said cemetery. And so I'm wondering through Councillor Hutchison if his intent was to potentially utilize Cataraqui Cemetery, or if it was in fact set out a new plot of land, perhaps Skeleton Park, perhaps.
Councillor Hutchison.
I would say the way, sorry, can you hear me? Okay. I would say that the intention of staff and the Green Burial Association and myself is simply to look at those options. If the Cataraqui Cemetery turns out to be a viable option that works, fine. Then, although at the moment my information is it doesn't really meet the tenants. So in entirety, and there are places across in the province, 3 or 4 of them, that meet some tenants, but not all. And so this, of course, would try to support a situation where all the tenants are met. So that's what the report's about. And so I'm just asking council to support the report, and we'll see what the options are when they come back.
Okay, thank you. Next is Councillor Doherty.
Thank you, and through you, Mr. Mayor. I just want to thank the mover of the motion and the seconder. I actually heard from quite a few residents in my district who are really, really supported, and we're really excited to hear about this because it does mean a lot to them. So I just want staff and everybody to hear that people in our community do want this to move ahead. So thank you very much.
Thank you. Is there anybody else that wishes to speak? Councillor Osanek.
Thank you, Your Worship. I just want to acknowledge that green burials is a new idea. Like, well, it might be, it looks like it was been around for a while in the United States, but me personally, I've never really heard of this until very recently. And then, you know, right after Christmas, we started to get emails about it. And I do know that some residents are very excited about the prospect of green burials. I might be green. I think this is too green for me, but, you know, acting on behalf of the residents who are interested in it, then at the very least, the report should be very educational, get the word out. And just like many years ago, not many people were, you know, did cremation. It was still a standard funeral, you know, being buried 6 feet under in a casket. Now cremation is happening all over the place, a lot more commonplace. Maybe green burials will be very commonplace too in the near future. So this is a good educational purpose when the report comes back. Thank you.
Okay, thank you. So I think with that, we'll call the vote then on new motion number 1. All those in favor? Opposed? And that's carried. Okay, moving on. Are there any notices of motion tonight? Okay, seeing none. Mr. Clerk, ask for minutes, please.
Moved by Councillor Doherty, seconded by Councillor Chappelle, that the minutes of City Council meeting number 7-2021 held Tuesday, March 2nd, 2021 be confirmed.
All those in favor? Opposed? And that's carried. Okay, we have some tabling of documents, a number of communications. Is there any other business? I'd just like to note that it's been exactly 1 year since we had our first council meeting on Zoom. Hard to believe. Kind of seems like it's normal, but 1 year and counting. But we will get back in person eventually. Okay, with that, Ms. Clerk, will ask for bylaws, please.
Moved by Councillor Chappelle, seconded by Councillor Hutchison, that bylaws 1 through 10 and 12 through 16, 18, and 17 be given their first and second reading.
All those in favor? Opposed? And that's carried.
Moved by Councillor Chappelle, seconded by Councillor Hutchison, that clause 11.36 of bylaw number 2021-41 be suspended for the purpose of giving bylaws 1 through 3, 6, and 7 3 readings.
All those in favor? Opposed? And that's carried.
Moved by Councillor Chappelle, seconded by Councillor Hutchison, that bylaws 1 through 7 and 11 through 16, 18, and 17 be given their third reading.
All those in favor? Opposed? And that's carried. Okay, with that, I'll ask for a motion to adjourn, please. Moved by Councillor McLaren, seconded by Councillor Bone. All those in favor? And we are adjourned. Thanks very much, everybody. Have a great night.